Doctors and therapists have read it. Do you have any "no, that's not normal" stories? If so, what abnormal habit or oddity did the patient have thinking it was normal? Story number 1. When I was in medical school, I had a mother come in because her son was having behavioral issues at school. He was skipping, depressed, didn't take long to find out. He had encopresis. He basically pooped himself without knowing it, which would be hard at any age, but especially in school. Deep dive, he played Xbox every waking moment with no bathroom breaks, stretched things out until he lost sensation, and stuff could squeeze out. Story 2. When I finally got on medication for my anxiety, I found out getting irrationally angry and frustrated almost to the point of crying and screaming at people for touching things certain ways, putting the dishes away wrong, chewing, moving my stuff a few inches, or talking to me when I didn't feel like talking was, in fact, not normal. Thank God for Prozac. Story 3. 95-year-old veteran 5 years in remission from kidney cancer. Came in with 72-year-old wife for a routine follow-up. She wants to know if it's safe to have sex every day, because she's worried about his health. Yep, 95 years old. Fucks every day. No Viagra. We just said, congratulations. Yes, sex every day is very good for your reproductive tract, penis or vagina. It keeps blood flow going and helps you maintain the function of your bits for as long as possible. Use it or lose it, essentially. And it doesn't have to be with someone else, either. Story 4. I feel like my story belongs here even though I'm the patient, since the exact scenario happened to me. A few years back, my mental health totally took a skydive. As a result, I dropped out of school and had to start a recovery program. The first thing I had to do was talk to a psychologist. During these conversations with the psychologist, she'd focus on different parts of my life. So one day she'd ask about relationships, and the next, childhood memories, and so on. After a few conversations, she focused on my social life. I then told her that it's pretty much non-existent, and it always has been. She then stated that I must have suffered from loneliness a lot then. I just told her that I've never actually felt lonely at any point in my life. After all, it's pretty hard to feel lonely with two voices in your head always keeping a conversation. But surely she knew that, right? Well, as it turns out, no. Apparently, everybody else only has their own voice in their head. My entire life has been a lie. Turns out I'm schizophrenic. Who the fuck knew, eh? Story 5. It was more like I realized what was happening was not normal, and it led to the client being diagnosed with what I can only assume was rapid cycling bipolar 2, with psychotic features. Was referred to a more appropriate agency after initial intake, so I didn't do the official diagnosis. He came in and was so down about his life that I called in another therapist to do a suicide assessment together. Once we were going through the questions, the client became excited at having an audience and did a 180 in demeanor. I have never experienced someone flip so quickly. Aside from the mental health stuff, the client was a really cool person, whom I hoped would get proper medication and go on to live a happier life. Lots of achievable hopes and dreams, and is a really intelligent person, delusions aside. Story 6. Not an oddity or habit, but I was the patient who had 48 hours ambulatory EEG done over the weekend. Had it put on a Friday, go back Monday. An hour or so after it went on, I started noticing it hurting where all the leads are. I'm thinking, no one told me this would be so uncomfortable. I couldn't sleep all weekend. My head was burning and I couldn't get in touch with a doctor. I called the on-call doctor who said that was not normal, and that if it was too intense, go to the ER and get it off or come in as soon as the clinic opens Monday. I waited, paced all weekend, and kept myself occupied. Monday morning they took it off and the leads burned into my skin all over my forehead and scalp. I'm apparently allergic to that metal on the leads and never knew, was having an allergic reaction. The burns were so bad and deep that I had to see a plastic surgeon. Story 7. Not a doctor. The thing that happened to me myself. For around half a year I had cramps each night, lost weight, could not shit, had worsening eyesight, my urine smelled weird, my skin was extremely dry, etc. I had seen a doctor about the cramps since those were the first things I did. He had recommended magnesium, but that did not help. Anyway, I went on like, that is gonna get better for almost half a year until I saw the same doctor once again and had him take a blood test. Turns out I have diabetes type 1. He could not even tell me the difference between types 1 and 2 though, so I never went to him again. Story 8. I guess I'm the patient. I had epilepsy when I was young and I was put on carbamazepine. I was on that for 8 to 9 years at a very high dose. Simply the NHS forgot I was on it and kept prescribing it. A doctor eventually took me off it. I had to wean off it for a fair while. The nub is, when I was young, I had an excellent memory. I could remember the minute detail. My family sometimes told me that I was a memory bank. After that point, my memory is shockingly bad. Like entire long chunks of time have just gone. For example, I did a project at work about a year ago, which took a long time. Someone logged a bug in my code, zero memory of my ever producing it. I thought it was a normal thing, just getting old. I think I asked a question on here, but the upshot was to get it checked out. My girl at the time was particularly vocal about it, demanding that my memory problems were not normal. I figured out there were times when I was doing something but had no idea what was going on, but remained perfectly fine. We would have conversations and I'd have no idea what we were discussing. I'd remember events totally out of order in terms of sequence or completely wrong, i.e. conversations with multiple people who couldn't possibly have been there. Lots of things. I went for EEGs, discussed my absences, and how I usually remember things by attributing certain facts to some sort of number trick which I wasn't really conscious of. I just did it, and I realized that would do things, e.g. date and remember nothing of it. This isn't constant, it's just random. I also get sleep paralysis and the rest of it. While this sounds horrific, it's not too bad. I have TEA, but I don't view it as life unlivable. Just sometimes I won't remember things, even with heavy prompting. I was offered a controlled drug, but I declined as I don't think I'm bad enough. It doesn't irritate me enough to do it. I just live by my wall calendar and a couple of notepad.txt files on my computer, and that does me fine. Story 9. These are all pretty common, but it's happened to me 3 times. The first was when I was in about 10th grade and had been having my period for about 2 years. I didn't realize that I wasn't supposed to be completely debilitated for a week each month. Uncontrollable vomiting and diarrhea, passing out from the pain, not being able to move, etc. The day my mother finally took me to the doctor was after I had missed a few days of school and went back, only to have her pick me up early. I clearly remember walking down the stairwell to the office and having to sit down because I couldn't move. The pain was so bad and I was afraid of fainting. When I finally got to the car, I was curled up in a fetal position and eventually blacked out. She made me an appointment that day, and since being put on birth control, I've had almost no issues. The next 2 were pretty recent. I'm a psychology major about to graduate, and I still didn't realize I was suffering from depression and severe anxiety. I'd been having a hard time coping with a huge amount of stress stemming from a few situations that happened this semester, and decided to see a counselor on campus. She diagnosed me and sent me to a doctor where I went on antidepressants. About 6 weeks later, and I feel back to normal. Better, actually. Looking back, it's pretty clear I've probably had anxiety since I was a teenager, but just didn't realize it. Turns out, you're supposed to want to get out of bed and live your life. The last thing. I always thought I just had bad self-control and no discipline. I thought I was just fat and gross. Nope. Binge eating disorder. Still working on that. I think this stems from a need for control, a bad coping mechanism, and body issues since I was a child, brought on by comments from adults. Growing up, you were taught that only really skinny people have eating disorders. Nope. Story 10. Was an in-home health assessor for state insurance. In the apartment of a bed-bound obese woman and her 10 to 11-year-old son. Disgusting apartment. Noticed large wet stains on the carpet and asked if there was a leak. I'd have to notify Medicaid, who would then reach out to Section 8. Nah, that's where I get up and pee. I don't use the toilet, and my lazy son won't clean it up. I used to see this kid out and about, usually a town or 2 over, just walking. He had a very noticeable deformity and was the nicest kid for his age. Haven't seen him in a few years. I bet mom died and he got into appropriate care. Story 11. This actually happened to me. All my life, my joints sometimes popped out of the socket. I would always pop it back in and carry on. One day my hip went out and I fell, and I popped it back in, took a Tylenol, and hours later, it still hurt like a bitch, so I went to the ER. Told the doc what happened and he takes it very seriously, and I said, "It's not a big deal. Happens all the time. It just won't stop hurting and I'm afraid I may have broken something." He says, "What do you mean it happens all the time? It shouldn't." I said, "Well, it does." He replies, "Have you not told your primary about this? That's not normal." I was like, "It's not? I thought it happened to everyone." Apparently not. The doc prescribed a painkiller and told me to be careful and to see my primary. Long story short, I was diagnosed with EDS. Story 12. A 50-ish-year-old man who came in for chronic issue follow-up brought his wife with him this time around. At the end of the visit, she says, "Hey, tell the doc about that thing you can do." He turns to me proudly and tells me that he can whistle from his penis. If he really pushed, he could blow gas from it. His wife insisted it wasn't normal, but he was certain most guys could. Turns out he had a connection between his bowel and his bladder. Mom brings her kid in because the babysitter was concerned about these spells the child would have. Apparently, the child would have episodes where he would just blankly stare at them and not acknowledge whatever it is they were telling him, or whatever he was doing. The parents just thought he was being an asshole and not listening to them, or being absent-minded. The kid turned out to be having absence seizures. A younger gal who had come in for generalized abdominal pain that she experienced on and off for years, but just always wrote off to either menstrual cramps or bad food or life. We had asked her if her bowel movements were regular, and she said yes. At some point, someone was sharp enough to ask her how often she had bowel movements, to which she said, about once every 2 to 3 weeks. She had been suffering from pretty severe constipation, but just thought it was normal to have BMs once or twice a month. I'm sure I have more, but I think I wrote enough for now.
Doctors of Reddit. What's the biggest case of faking it you've ever seen? Story 1. 30-year-old woman comes to the ED with such excruciating belly pain. Paralyzed, oh god it hurts when you press there, and must have oxycodone now. ED doc said if she can get out of the ED bed and do 20 jumping jacks, we can give her the oxy. She did 20 jumping jacks, then got kicked out of the ED. Story 2. My cousin got glasses, and her 7-year-old little sister also wanted to get glasses because she thought it was so cool to wear them. So she started telling her teacher she couldn't read what was on the chalkboard, and she'd squint at home and go incredibly close to the TV to watch things because she said she couldn't see things clearly. Her parents got worried and took her to the doctor. She read everything wrong on the vision test. Everyone seemed convinced that she needed glasses, but the doctor was a little concerned because the test indicated she needed really thick glasses, and usually that wasn't the case unless there was a family history of vision issues. Her parents both had 20/20 vision, and her sister only had astigmatism. They all realized she was faking it. So the doctor told her parents in front of her that she'd need some pretty intense eye surgery so she'd be able to see without glasses. They even wheeled in a machine to make it convincing to say they could do the surgery right then and there. She freaked out, confessed to faking it all, and started to cry. She got grounded for a while. Story 3. I'm an ICU and ER nurse. We get a lot of malingering in the ER. One day, one of our freaking flyers came in and started faking a seizure in triage. Now, obviously, I know this lady, and she's fake seized a million times before. But this time, it's in the lobby in front of about 30 people who have no way of knowing that it's fake. She's rolling around on the floor, making a damn fool of herself, and folks look horrified. I walked up to her and said calmly, "Karen, what are you doing?" To which this genius responds, "I'm seizing." I told her to stop seizing, so she did. Edit, no, her name wasn't actually Karen. I just did that for confidentiality. Oh man, I would love to have seen the face of all those people watching this unfold. Story 4. I had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated hello wave. She started to throw her arm up, but caught herself halfway through, then threw her hand back into her lap and pretended to be staring off into nothing. A friend of mine likes to stick out her hand for a handshake when people come in feigning blindness. Nearly all of them instinctively meet her handshake. It's great to watch. Story 5. When I was a kid, I would plan my sick days way ahead of time. Had an old thermos that I would pour leftover milk, meat, whatever. Leave it on the windowsill in my bedroom, just letting it fester for a month. Of course, the thermos was closed, so no smells escaped. I set an alarm for the middle of the night, dumped the contents of the thermos on my rug, and ran in to tell my dad I was throwing up and so sick. However, this thermos monstrosity filled the entire condo up with horrible smells, and both me and my dad ended up puking into the tub at the same time every time we tried to clean up the rug. He had to take the day off work too. Needless to say, I never pulled that again. I never, ever came clean about it either. He talked about the puke till the day he died. He thought I was dying because of how bad it smelled. I told my dad a lot of my stunts as I grew into an adult, but that one stayed in the vault. Puke thermos, not a great idea. Story 6. Years ago, I had a patient who had been rear-ended in an auto accident a few weeks before I saw her. She had a history of lupus. She was decked out in the usual I'm crippled paraphernalia, crutches, neck brace, elbow braces, wrist braces, knee braces, and she could barely walk. I saw her a couple of times and she showed no improvement. One Saturday, I was on call but had to take a back streets route to the hospital because of an event taking place on the main thoroughfare. I apparently drove through her neighborhood because, wonders behold, there she was wearing old lady spandex, power walking down the sidewalk, holding weights in both hands. I did not call out to her. Next week, she was back in the clinic with her "I'm crippled" getup on again. A few weeks later, I got the subpoena for the deposition and it all became clear. I could not have sworn under oath that I had absolutely positively identified the woman power walking. I know it was her, but I later confirmed she lived in that area. She and her attorney could have argued that it was her sister or daughter or cousin or whatever. So I just honestly answered all the questions during the deposition. Many I could not answer because I did not see her immediately after the accident. I could, however, honestly say that I thought she was a good prognosis and was likely to recover fully. By the way, it's not unusual for patients seeking compensation through some legal process to exaggerate the degree of their injuries. Everybody involved in the process understands this. It is, however, incumbent upon the patient to maintain their act in a believable fashion. Story 7. Fourth-year medical student. On my ER rotation and trauma came in from a woman that had been arrested. During the drive, the patient banged her head 4 times against the window of the police car and then went unresponsive. She came to us with a bruise on her forehead and was unresponsive. We all smelled BS, but the patient was a great actor and didn't even flinch during the digital rectal exam, which is standard for all patients that come in through the trauma bay. Though some of the nurses said that they caught her peeking at us when we would leave the room. We ended up getting a CT scan, which was normal, and were even considering intubating her to secure her airway, when our attending finally walked over to her, opened her eyelids, and held them open while telling her to wake up. Finally, she started fighting to close her eyes, and the jig was up. The doctor called her out, and she proceeded to start screaming at us. She was much more pleasant when she was pretending to have a brain injury. Why is a digital rectal exam standard for all trauma patients? Story 8. I'm not a doctor, but a nurse. There was a geriatric patient taking advantage of the call bell because she was an attention seeker. She always needed really basic things to get done for her because she thought the place was a hotel. It was a rehabilitation ward and we should try to motivate patients to do as much for themselves as possible. So she would ring the bell for reasons like, "Please lift the blanket up for me," or "Please pass me my phone," or "Please feed me," and claim that her hands didn't work. I caught her several times lifting herself off the bed with her hands, grabbing her phone when it rang. You get the gist. After days of saying no and that she needs to start doing things for herself, she grew more and more frustrated. Eventually, she snapped, grabbed me by my collar, shook me aggressively, and yelled, "What don't you understand about the fact that my hands don't work?" I didn't know what to tell her. I just looked at her and blinked as she slowly released her death grip on me. I guess I peeled her hands. Praise the Lord. Story 9. Male patient, 18 years old, rolled in unconscious. Mom says he's been like that for the past 4 hours. Go to check his lungs when I hear something interesting. I place the stethoscope near his mouth and hear him breathe in normally, but then breathe out by saying, "Breathe." No choke. Male patient, 21 years old, admitted with an inability to speak for the last 2 hours and respiratory distress. Lungs are clear, but we hook him up to the oxygen for a few minutes. After he's taken off, his father comes running in and drags me over, saying his son's tongue refuses to go back in after receiving the oxygen. I look at the kid and he's seriously just lying there with his tongue poking out like a child. I tell them to push it back in, and a few hours later, the dad tells me the boy is convulsing. I go to see him without making my presence known, and he's lying there just fine. The moment I ask the mom how he's doing, he starts convulsing. Think of an odd version of the worm, but on his back. Female patient, 16 years old, admitted with complaints of recurrent seizures and frothing from the mouth. I look at her, and she's literally blowing spit bubbles. I check her reflexes, and everything is intact. The moment I turn away to check on another patient, she suddenly becomes rigid and the spitting intensifies. Male patient, 30 years old, unconscious, and completely unresponsive for 6 hours. This guy was totally dedicated to his act. I initially approached it as a stroke, but when the blood pressure, ECG, reflexes, pupils, etc. all are normal, I started checking pain sensations. He slowly began to open his eyes and groan as I asked him to tell me his name. But the moment his Achilles tendon was pressed, he suddenly sat up, stated his name, and declared himself cured. Female patient, 17 years old, complained of respiratory distress and convulsions. Everything's normal on admission, and she's conscious but refuses to eat. Parents are worried out of their minds, and every few minutes she has a fit where she would just basically shake from side to side. She let slip to a nurse that she didn't want to go to school that week, so she was just faking an illness. Since she was refusing to eat, the attending wrote up an order for a nasogastric tube, which was inserted and then removed by her in a matter of minutes. What was going on with the first kid? He was verbally coaching himself through breathing? Story 10. Obligatory, not a doctor, I'm a nurse. We had a guy who had to come in every 3 months to get a medical certificate to say he couldn't work at his retail job due to severe disabling back pain. He was receiving large amounts of insurance money for this condition. After the doctor had done his usual examination and questions and signed it off, the guy asked the doctor to check his shoulder, which the doc does, and asks how he injured it. Guy says playing rugby for a competitive team. Really, says doc. How long have you been playing for them? The guy has been playing and training the whole time. So the doc puts this info on the insurance form. Doc loses his shit in the staff room laughing, and the next week the patient loses his shit in reception because his insurance has been canceled. Story 11. A young 18 to 20-year-old woman went running into a small rural hospital ER pretending to have abdominal pain. The police officer had tagged her going 40+ kilometers over the limit, which was stunt driving as per the new law in Ontario, impound and license suspension automatic. The cop followed her into ER and apparently said he'd be waiting for her when she left. Locum staff, such as myself, were housed at a small B&B about 15 minutes away, and the ER had pre-printed order sets to be done before we arrived. When I arrived, she flat out admitted that she just came in because she freaked out and didn't stop. I told her we'd give her 45 minutes to call her parents and family before I booted her. Except her BHCG came back positive and subsequent ultrasound came back showing extremely early ectopic. So the officer figures out something is up when he hears an ambulance call come in over the radio. She was completely asymptomatic and just worked out that she dodged both charges and a life-threatening issue by accident. It was definitely a what the F moment. Edit, well, this blew up overnight and I got a few messages. So a little more info. Small rural hospitals in northern Ontario often service areas from more than an hour's drive away and still only have a catchment area of 2,000 to 3,000 people. When on call, it was just that. We would do our days in the community clinic, then maybe hospital rounds, then go home and be on call. We wouldn't be at the hospital. There wasn't an on-call room where you would stay, for example. There were lots of times that you'd go a full night without even being woken up, or maybe just a call from the acute care inpatient wing. Locums were short-term contracts for places that didn't have full-time medical staff for whatever reason. It's hard to attract clinicians if you don't even have broadband internet in the community. They generally pay very well. Story 12. Not a doctor, but am a UK-based midwife. Had a patient who had been in and out of the hospital throughout her pregnancy with episodes of heavy bleeding. This was her 6th baby, so she was a fairly well-known patient in our unit. The issue was no one had ever seen her actively bleeding. She'd call saying that she had bled down the toilet but flushed it, and all the examinations we did came back completely normal with mostly no evidence of any bleeding whatsoever. On occasions during speculum examinations, we'd see the smallest amount of blood. I was caring for her during a shift when she yet again called in to say she was bleeding, so I walked into her room and found her jabbing around her vagina with a sharp object to make herself bleed. She'd been doing it the entire pregnancy. The reason she gave was that she had 5 noisy children at home, needed some rest, and knew we wouldn't admit her to the hospital if it wasn't for a good reason. She would do it any time her being discharged home was mentioned. So we ended up having to complete a perinatal mental health referral and consult with the safeguarding midwives as she was putting herself and her baby at risk of serious harm. Story 13. This patient comes in for back pain with weakness in the legs. Gets a full workup with MRI, standard blood work, and then some immunological things to look for stuff like myasthenia gravis. No neurological or immunological explanation for the weakness. The patient is seen by a physical therapist, and they are of the opinion that the patient is holding back intentionally. Go to see the patient at the end of the day and prep them for discharge. The patient is infuriated that they're being discharged, yelling and screaming about how they aren't better, how they're disappointed in the institution, blah, blah, blah. They said one particular thing that still clearly stands out 3 to 4 years later. I can't believe you're sending me home already. I haven't even told my family I'm here, and now you're going to send me home before they even have the chance to see me? My attending and I leave the room to arrange things with the nurses. We go back in, and the patient is out of bed and standing up in the middle of the room. Miraculously, the patient is able to walk with zero assistance when they had so much difficulty with any assistance over the previous 2 days. At that point, they were enraged we went into the room without knocking. They were discharged home after a conversation regarding abuse of medical services. I could see that. A couple of my more socially isolated Facebook friends tend to post hospital selfies with captions like, "Interesting night," because they need some attention and haven't learned healthy ways to get it. The tearful family visit could be a big deal if what the patient really needs is a hug. Story 14. I once saw a patient who had been faking paralysis of the legs for years, used a wheelchair, never walked, etc. Old records showed extensive imaging, neurology consults, and other tests that proved the patient had full function of all extremities. Family and friends were just going along with it. Story 15. I am a nurse, but not a doctor. I had a patient who worked in a hospital, a janitor, so he knew enough to fake a bit. He was seeking pain meds, complaining of chest pain, and wanting morphine. He was worked up for everything cardiac, and it was all fine. Then he tried to claim GI discomfort when he was being discharged. Cleared again for everything, fake chest pain again, cleared again. Now he's my patient. I'm a new face. He's telling me he's having abdominal pain. I call the doctor, knowing this guy's history. He says he'll be up to see him soon. This patient wants a ginger ale, some stomach ache. I decided to go to lunch. My coworker comes into the lunchroom disgusted. This guy had taken a dump in a basin and then dumped the ginger ale over it and tried to tell her he had fecal vomiting. He obviously needed Dilaudid right now for the pain. I walked into his room and sure enough, a pile of shit in a puddle of ginger ale. I told him I'd have to take away his food and drinks and we'd have to put an NG down. Suddenly, he changed his tune. He admitted to faking it. Why do these people do what they do? Story 16. Taking trauma call during surgery residency, had a prisoner come in after a fight and claimed he couldn't move or feel his legs. All the CT scans and MRIs were normal, but we would shield his legs so he couldn't see them and poke them with needles and other sharp objects with enough force to cause pain. He never flinched or moved his legs at all. He was diagnosed with SIWORA, spinal cord injury without radiographic abnormality. He stayed in the hospital for a week with no improvement. Always had one guard with him. One night, they were down in the lobby watching some television, but the guard needed to use the restroom. The patient said, "Where could I possibly go? I'm paralyzed." Guard left him alone for 2 minutes. The patient was last seen sprinting down the road, naked butt cheeks flapping in the breeze. Made it to a city 4 hours away by car before he was caught again. I have never seen anyone fake it so well, truly playing the long con. Story 17. I'm a resident, not a psych resident, but this happened in my psychiatry rotation in medical school when I was in medical school. There was a patient at an inpatient psychiatric facility for suicidal ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined a physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature, and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with the factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously, so the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist, and her primary goal was attention from medical professionals. If she actually believed she was sick, she would have diagnosed her with illness anxiety disorder, commonly known as hypochondria. Story 18. Not a doctor, but worked in healthcare for nearly 20 years. While taking a break from the ICU due to it being emotionally draining, I worked in home health for a bit. I had a patient who clearly had Munchausen syndrome. On a daily basis, she would call her insurance to see what things would be covered if she was diagnosed with this or with that. She called her doctor's office an average of 5 times during my shift with her. She would report all kinds of non-real symptoms. She pestered the doctors into doing exploitative laparoscopic surgery, but of course, nothing was found. One day I walked in and she was rubbing her incisions with rotten cabbage, trying to get it infected. She wasn't seeking pain meds, except to sell. Really, she was just as happy with antibiotics or stool softeners, anything, as long as they wrote her a prescription and she got to go to the pharmacy, where she did a whole song and dance for them too, claiming allergies and reactions. She always increased the exaggeration of her story too. One time, she flooded her eyes after making sure I was looking, and said she lost consciousness in half a second. She called the doctor and claimed she lost consciousness for 5 minutes. She called the insurance and claimed it was 10 minutes. She called the pharmacy and claimed it was 30 minutes. Then she called 911 and told them she woke up on the floor after losing consciousness for 4 hours. The worst thing about her was she was a mom. Her son was 28 at the time, and by all the stories of his childhood illnesses and all her saying how he is severely disabled, I knew she basically fucked up his childhood with Munchausen by proxy. She portrayed him as being severely disabled, and that's why he would never find a wife. I met him. He was healthy and of average intelligence. He wasn't looking for a wife. He was gay, but she refused to accept that. Working with her was so miserable that I took a couple years off from any and all healthcare after that. Medical personnel of Reddit. What was the most uneducated statement a patient has said to you? Story 1. Don't eat or drink anything after midnight, before his 3-year-old daughter's surgery the next morning, tonsils and adenoids. While intubating his daughter the next morning, she vomited scrambled eggs, causing her to aspirate them into her lungs. Her heart stopped, and I did chest compressions for her for 25 minutes. We got her back, aborted the surgery, and transferred her to the pediatric ICU on a ventilator. Her father's response? She said she was hungry. I thought you were being too hard on her. It must have been something you did to her. Story 2. A 20-something-year-old patient comes to the emergency room. Chief complaint on the board is private. This should be good. He went in. He is visibly depressed and sad. He tells a story about how he slept with a woman, didn't use protection, and after he noticed she had a plastic box on her. When she told him it was an insulin pump for diabetes, he was mortified. Came in immediately to be tested for diabetes. Story 3. I had asthma when I was a child, so stop patronizing me and telling me how to raise my daughter just because you think you're smarter than me. Leaves hospital. Back in the hospital 2 hours later, her 6-year-old daughter was in respiratory failure and was admitted to the ICU. Story 4. Wait, secondhand smoke? Yeah, right, that doesn't exist. Baby, I'll be fine. And an hour later, no, my fiance and I don't want our daughter to have any of the vaccines, vitamin K shot, antibiotic eye ointment, or PKU testing. It's poison. Poking her with a needle is worse than the cold she'd get without the poison. He then drove his newborn daughter and fiancé home in a car that reeked of weed and cigarettes. Story 5. I used to teach GU, genitourinary exams. Med student asked this hillbilly guy to lift his penis out of the way so she can examine his testes. My what? Your genitalia, she says. Your penis. My what? At this point, I intervene. I point to his crotch. What do you call that thing there? Thomas. Well, get Thomas out of the way, would ya? Edit. Since people are asking, to do a testicular exam right really does take 2 hands. Also, we ask the patient to lift it out of the way himself because it gives him a sense of control over what can be a very embarrassing procedure. There are a lot of the steps in GU and DR, digital rectal exams, that are mostly just there to establish patient comfort, not to give meaningful information. This is not the only time I've asked someone what they called their genitals because they did not recognize the proper names. Most people are only taught euphemisms for their genitals growing up. Once upon a time, it was not discussed in school for reasons of propriety. It remains an anatomical gray zone for a lot of people. They know their thumb is their thumb because their mama called it a thumb, but their mama never told them what to call the thing between their legs. Story 6. I had a patient who came in with a heart attack. His brother calls me and starts with, now I know a lot about medicine. Seriously, I could be a practitioner. That's a direct quote too, and I knew at some point he was going to make a fool of himself. The very next thing out of his mouth, so are all 4 chambers blocked? Priceless. Story 7. Patient to the pharmacist, confused and distraught over frequent vaginal infections. But I'm wiping back to front, just like the doctor told me. Bonus quote. Mother to 6-year-old whose $35 prescription wasn't covered by public insurance. Well, looks like you're fucked. Edit. Everyone involved was Canadian, so while the discussion on healthcare in America is important, it does not directly apply in this case. Also, while we are mostly proudly dirty socialists and we do have public healthcare for doctor and hospital care, prescriptions are still a private business, and there is a confusing mishmash of public and private insurance that differs from province to province, and there are still some people who have no insurance at all. In this case, the prescription was not covered under the provincial plan, but many similar drugs were covered. And yes, children are generally covered, they just happen to have a doctor that picked the drug, not on the approved formulary. Can't give any more details without getting into privacy issues. Story 8. It wasn't the patient who said it, but I think it fits in here. When I was a paramedic, we were called to a school gym because one kid lost his grip while climbing a rope and had a badly twisted ankle. When we arrived at the gym, the teacher tried to get rid of us by saying, "You guys can leave, he's just being a little crybaby, he can walk it off." It turned out that he had several torn ligaments and a broken leg, no mattress under the rope. Also, one of the kids had to call 911 because the teacher didn't think it was necessary. We met the parents at the hospital, and once they had taken care of their son, we approached them and told them how we were greeted. The mother instantly went to the school, and let's put it this way, seeing her face when she left, I can imagine what happened when she arrived. We filed our usual report with the fire department, and that was the end of the official part. But since medics and cops get along great in my part of the world, we mentioned this to some cops we met at lunch later that day. They followed up on it, and according to my cousin who was attending the same school, he was fired the next morning. But I can't tell you if any legal action was taken. Story 9. My old doctor said I could keep this pair of contacts for a year. This girl comes in with the same contacts she got as trials over a year before, and she had never taken them out. Not to mention these weren't night and day contacts, these were bi-weekly AccuView lenses. She did not leave very happy that day. Here's what happened. She had a drastic change in prescription. She was also referred to another specialist because she did major damage to her eyes. The doctor absolutely would not let her get a prescription for contacts and told her it was best to never wear them again. I'm just a pre-med student shadowing a doctor right now, so I'm not exactly an expert, but what I can say is that you can never be too careful with contacts. They can cause serious damage to your eyes, and they are luxury, so don't be so careless. And to everyone who says they do things similar to this patient, stop. It's not impressive that you are risking your eyesight by not taking care of your lenses. Story 10. A woman comes into the emergency room with a 6-year-old girl. The mother is frantic and crying. "My baby's tooth fell out. It's my fault." "How is it your fault? Did she fall or something?" "No, it's my fault because I didn't give her the good juice with concentrate in it, and now all of her teeth are gonna fall out." Me, genuinely confused. "Concentrate? If you don't give kids juice with concentrate in it, the one with the big letter C on it, all their teeth will fall out." "Ma'am, your child is 6 years old. She's going to lose all of her baby teeth now and get her adult teeth. She does not have scurvy." Another one. A 12-year-old girl with full-blown AIDS in the ICU and likely going to die has a pleasant habit of biting herself on the cheek enough to get it to bleed and then spitting on the nurses and doctors in an attempt to inoculate them. When I confronted her grandmother about this, asking her to help us control her granddaughter, she said, "Well then, why don't you just give her the cure? You, white people, made AIDS kill all the black children, and you give the cure to the white girls but hide it from the black girls." Or another. "Ma'am, I think the reason your COPD keeps bothering you is that you still smoke. You need to stop smoking." "My daughter's on crystal meth all the time and she's fine. If you get her off of crystal meth, then you can talk to me about my smoking." Or another. "No, I don't want any vaccinations to make my daughter autistic. My son is autistic now because of that shit. You wouldn't give any more shots to kids if you held an autistic kid in your arms while he's crying." I had to bite my tongue on that one, not to say, I have held autistic children. I imagine you would allow vaccinations after the first time you held the body of a dead toddler who died of whooping cough. I have lots of these stories. The patient with AIDS was often admitted for months at a time and had a lot of serious issues. She did manage to survive the hospital stay, but I heard a few years later that she had died. This is rather sad because in this day and age, I saw this patient about 6 years ago, HIV should not be a death sentence. I have been told by a well-respected infectious disease doctor that with modern treatments, it is probably better to get HIV than diabetes, and they may have a point. The patient also, by the way, when she was a couple of years older, was known to sneak into the rooms of other male teenage patients and try to have sex with them. They had to post a security guard at one point just to keep her in the room. This was a story of ignorance perpetuated throughout generations of a family, but it's hard to argue about where that ignorance came from, seeing as the United States has a long history of poor medical ethics when treating blacks. In inner city DC, where this happened, many of those memories run deep. Story 11. I work in a hospital, but I'm not part of the treating staff. I just get to deal with the crazed side of things. 8-year-old boy turning blue in the lips, hardly moving, babbling. The blood test comes back. Potassium is so low the child's heart is about to fail. The child has other issues. The doctor calls for emergency medical transport to a children's hospital in Tampa. Both the mother and grandmother say, just give him the prescription, we'll pray to Jesus to save him, it'll be fine, we have bingo later and I'm not driving to no Tampa. They remove the child's IV and head outdoors. I inform them they are making a horrible choice. They must get the child treatment because he is near death. They say, but we have a hair and nail appointment. Jesus will save him. DCF, Department of Children and Families, is called, and with a police escort, they are brought back. A young male and female come in ER. The female is pregnant. The male keeps asking questions. If I have lots of sex with her, will it make the baby mine? If it hurts when we pee, that just means the baby is upset we had sex. A guy with an open wound to the leg via chainsaw, blood gushing out, the guy is turning white. They cut off clothing and remove shoes. Shoe is full of blood, other is covered in it. They hit his leg with a clotting agent. The bleeding seems to stop. The patient runs out of ER saying he'll be fine. The patient was located dead an hour later with blood loss. The wound began bleeding again, was found in the car in a parking lot. His family was outraged that we threw out his new shoes. An older man comes in, really bad shape, stage 4 cancer. Children come and demand he is released. He's doing better, they say. All the while, he's no longer responsive and lost the ability to walk. He's near the end. Kids get a lawyer, get control, and have power of attorney. They take him out of the hospital. The guy calls for an ambulance 2 days later and comes back in severe pain. Kids show up and sign him out against medical advice. The guy is crying and fighting to stay. Kids lift him into the truck and he's crying the whole time. Turns out kids stood to get hundreds of thousands of dollars upon his death. Just wanted him to go sooner. This was said by the daughter. He gon' die, what does it matter? We gotta use the money. After stuff like that, things just get sad. Things get to a point that happen that just make your eyes roll. People are horrible at times. Story 12. This isn't the most uneducated, but it's pretty classic. I work in pediatric critical care. At my first job, we had this kid that was immediately post-op from a small surgery, doing great, and was probably going to sleep it off and transfer to a general floor the next day. The mom wanted to snow him with drugs and kept on insisting he had pain, which he denied and had no vital signs or actions to suggest he was hiding. He was getting scheduled opiates and Tylenol, but this lady kept insisting on something IV. When she didn't get anywhere because the kid kept denying pain, she asked for something so he would sleep through the night, and the nurse said, "We can try some Benadryl," and the lady snapped. She demanded a doctor, berated the nurse, and essentially said we were mistreating her child who was, "Mom, OMG, I'm fining," the whole time as he played Xbox. The doctor on service was this awesome, brilliant man who was tired of dealing with this lady drug-seeking for her kid. He put on a smile, asked what the concern was, listened to her complain about how the nurse had offered the kid Benadryl, cocked his head, and said, "Well, what about diphenhydramine? Have you ever tried that? It's a very effective sleep aid." For anyone that doesn't know, Benadryl is a brand name for diphenhydramine. They're the same thing. Immediately, the lady perked up and said, "Diphenhydramine? Yes, let's try that." Meanwhile, the bedside nurse is struggling to keep from laughing, says, "I'll go get that," and runs to the Pyxis drug dispenser in the locked room, where she loses it. The kid got his diphenhydramine. Story 13. An ex of mine was treating a patient that was admitted for severe contractions and was far along in her pregnancy. Patient, "Can you give me that shot so my baby doesn't get AIDS?" Him, "You failed to mention you were diagnosed." Patient, "I don't have it, but I know there's that shot that they give women when they are pregnant so the baby doesn't get infected." You can't make this shit up. Story 14. I had a Mormon couple come to my clinic because they had been trying to conceive for the past 6 months. The couple was in their late teens, early 20s, and pretty healthy looking. I did some investigations and neither of them was infertile. It turned out that the husband was a minor on a 4-week on, 2-week off schedule. So what they had been doing is a man would and save up his sperm in Coke bottles. He then mailed them to his wife for her to inject into her womb via a bastard-type thing. To make things worse, she would store the sperm in her freezer and would only inject up the day after her period. The couple got this idea from the internet as a form of artificial insemination. They thought this was a good idea because they had sex once during which the girl experienced lots of pain. So they hadn't tried normal, natural conception methods since. More info on the story. When they first came into the clinic, they seemed perfectly fine. I asked them about their intimacy and they gave stock standard responses. Nothing suspect. It was only after I ran some tests on the guy's semen and sent the girl out for a gyne referral, which took a month and a bit to organize, that they finally were honest with me. I guess at that point they realized that nothing was wrong with their tackle, so the problem must be with the way they were fishing. Anyway, we had to run some education sessions for them and send them off to a sex therapist to handle the pain and intimacy issues. After 3 months, they were pregnant with twins. That case was one of my most memorable incidents. It was weird because at the time I was only 22 at that point. Can you imagine that? I, a 22-year-old, had to give the birds and the bees talk to a 19 and 21-year-old. Frickin' weird. I'm surprised they even wanted me to be their physician given how young I was. I guess my beard made me look like I was in my 40s. Since then, I returned to Australia. I've practiced medicine in some desert Aboriginal communities where people believe sticks, snakes, and magic cause things like heart disease and stroke, even though their diet consisted of eating nothing but butter-soaked butterballs and butter broth with a pound of fatty meat on the side. There was a lady who thought her son's schizophrenia was because another tribe had put a curse on their family. This resulted in a community-wide feud as members of the schizophrenic's family sought revenge by beating up members of the curse-giving family with bush spears and such. The police had to come down and sort that one out. Yeah, there are a lot of crazy stories in medicine. I'll be sure to write out some more when I wake up tomorrow. Good night, everyone. Story 15. My pharmacist friend had this conversation. I know what vaccinations can do to you, injecting viruses into people. I won't let any government control my child. I don't want that disability wage they give to them kids from vaccinations because I can raise them by myself. All she asked was if they had their yearly flu shot due to being at an elevated risk of catching the flu, school, childcare, and the mother was a health worker. Story 16. I am not a medical person, but I once thought I was having a heart attack at work and drove myself to the ER. I was placed in a bed with a curtain after skipping triage and getting an EEG, EKG right away in the hallway. Out of the 5 other roommates separated by curtains was a 53-year-old man that was there for a burning sensation in his penis. I know this because multiple people came to talk to him about his condition and he had no volume modulation. What everyone kept asking him was, "Did you put something chemical in your penis?" His response to each one was, "Yeah, I might have." It took 5 nurses and a doctor before he finally fessed up to what it was. Bleach. He said he dribbled bleach into the tip of his penis to keep him from getting an STD. The nurse was silent for a few solid moments before asking why and if he did this every time he was active. He said he wanted it clean and that he wasn't active at the moment. He wasn't active. He had done it after masturbating and was under the impression his could have infected his dick with something he didn't want. She then had to lecture him that if he wasn't active with another person, he likely wouldn't contract an STD and that soap and water are a good way to clean his genitalia in the future. I was frozen in my bed making that face from Edward Munch's The Scream and my wife mirroring it back to me. The man was moved elsewhere, perhaps to rebuild his urethral lining, and we were still too shocked to discuss it until leaving the hospital 4 hours later. Story 17. I'm a nurse who has worked in the burn trauma ICU and I am now a hospital supervisor during the night shift. The stuff that people come into the hospital with is mind-blowing, either their medical problem or their social problem or both. My most recent and favorite experience was a patient who called the hospital condition concerned line wanting to know why we were not teaching her how to feed. The operator who passed the call to me thought it was a prank at first. I go to the mother-baby floor to meet with these people and talk to their nurses. I come to find out that the mother has tested positive for heroin in her urine. It also tested positive in her newborn, and she also has a current history of marijuana use and a history of substance abuse. Her last 3 children have been taken by CPS, and tomorrow, which is 5 hours from now, as they decided to make this complaint at 3 a.m., her new kid will get taken away. I go to talk to this woman to explain why we can't teach her to breastfeed due to the heroin in her milk. The stuff that comes from this creature's toothless mouth is unbelievable. Her first statement is, "Your job is to teach my kid how to suck my tit." And I don't know why the hospital is doing this to me. I don't smoke that much weed. I'm cutting back. She ignores the here and thinks it's the weed. And I always feel good on him. I talk with her in circles for a little while, and it finally ends with her saying, "Fuck it, I'm having the smoke." So she gets up, leaves, and that morning, CPS comes to take her kid away. The kid was in the nursery the entire time, and I'm told she barely even looked at it since birth. Story 18. I'm a vet and met a lovely lady with a puppy the other day. I asked how old he was just to be friendly and because my dog was saying hi. He was only 10 weeks, so I inquired if he had been vaccinated, again out of concern that I could pass something on to her pup. She told me that she didn't need to vaccinate her dog because he was on the lead and that vaccinations were designed to give her dog autism. I just walked away. Story 19. This lady was morbidly obese and had already lost a leg to diabetes. While on the basic medical floors, she and her family would consume large quantities of fast food. She couldn't lift her own chest up enough, and she eventually went into respiratory failure and ended up on a breathing machine in the ICU. When we finally wean her off the machine and the tube gets pulled, the very first words out of her mouth are, "Can I get some fried chicken from the cafeteria?" Doctors, what was the worst thing you've seen for a patient that another doctor overlooked? Probably the worst story one can hear. My wife found a lump under her breast that was really concerning. It took her about 2 months to get a proper appointment to have it looked at. Doc diagnosed it as a cyst and a fibroadenoma. She drained the lump and it was fine, grew back a week later and it was bigger. Finally, after being in pain for weeks on end, the doctor said this is clearly not working, so we will do surgery and remove it. Upon going in for the checkup thinking they'd take a look at the scar and healing, it turns out she had stage 2 triple negative breast cancer. The surgeon was absolutely floored. The most upsetting thing was that while her main surgeon and gyno, who was fantastic, was on holiday, another male doctor told her, quote, any surgery would be merely cosmetic and it clearly didn't bother her because he could touch the lump. I almost slayed that doctor out in the office. When she got the diagnosis, he apologized to both of us for being a jerk. Unfortunately, this story doesn't end well. Despite doing 8 months of therapy, chemo, and radio, her cancer returned 7 months later and ultimately led to her demise after it spread to her brain and spinal fluid. So many people told me, breast cancer, that's one of the easy ones. My insert relative nobody freaking cares about here had it. She switched gynos twice because they wouldn't take it seriously. It's been 6 months now and not a day goes by where I wish I could have taken her cancer away. She was freaking 27 years old. To anyone facing a cancer diagnosis or even a triple negative diagnosis, do not be deterred by the story. It is not your story. Keep fighting it. Live for yourself or my wife. To hell with cancer. To everyone wondering how I am doing, it's been 6 months since she passed. Though I have been grieving for a while longer, anticipatory grief they call it. And so, considering everything, I'm doing well. It was her birthday on February 28th, and she would have been 28, so the week was quite solemn. But other than that, I've found ways to move forward with her, not from her. Whenever I have a moment, I let it happen and then continue. I do have PTSD from her time in the hospital, but I am learning to deal with it, and I will go to therapy. All in all, I am doing well, enjoying life, and just processing all my feelings. I miss her every day, and will for the rest of my life. I've had a few people tell me to sue the doctor, especially considering the cost of treatment, etc. I live in Berlin, Germany, and despite that unfortunate initial diagnosis, her treatment and care have been a breeze afterwards. She received care from the Charité, Berlin, one of the finest medical institutions in the world, and because of our healthcare system, we haven't paid a dime for any of her treatment. It's been a while and I am at peace with it all. I'm not going to go down the litigation path and sue a doctor for something that happened a few years ago in 2019. Though I do understand your concerns. Thank you all. I'm sorry for your loss. It's unfair and horrible and I hope you heal in due time. Story 2. I'm a psychiatrist and I'm frequently angered by the lack of care that our patients receive from some other doctors. Emergency rooms can be the worst about this when they're trying to shuffle patients through to psych admits as quickly as possible, sometimes neglecting other basic aspects of care in the process. Not every ED doctor is guilty of this by any means, and some are remarkably good about providing appropriate care for this population, but it happens far too often. Probably the most egregious incident occurred a couple of years ago while I was on overnight call at a VA hospital. So it started with a relatively routine call asking to transfer a patient to our psychiatric unit from a community hospital emergency department for treatment of psychosis. He was an older guy, I want to say early 70s, who had come in acting strange and delusional. His son in law had told the ED staff that he had received care with use for psychiatric issues before. I asked them to fax the transfer packet, a bundle of the assessments already performed there, and I started looking at his chart in the meantime. However, what I found was that he had not actually been admitted to our psychiatric unit. He had been seen by our psychiatry consults team for delirium while he was admitted to the medical floor for decompensated heart failure. For anyone unfamiliar, delirium can occur with any severe illness where your brain basically isn't functioning properly due to the psychological stress your body is under. Sometimes it just manifests as confusion or disorientation, but sometimes it can get more dramatic with delusions and hallucinations. From what I saw in his chart, he had no actual primary psychiatric issues and had only been seen by the consult psychiatrist while he was delirious. So I get the transfer packet for this guy, and not only has there been no cardiac workup for this guy who has a known history of heart failure, there aren't even vital signs on him. The only labs are a CBC, pretty unremarkable, and electrolytes and kidney markers. These chemistries are also not too abnormal, but I noticed that his urea nitrogen is a little elevated. This is generally a sign of poor perfusion through the kidneys, as reabsorbing this urea also helps the kidneys reabsorb every last bit of water they can when the body is dehydrated. However, dehydration and low blood volume is only one possible reason why the kidneys might see reduced perfusion. Another possible reason would be if some had uncontrolled heart failure. So I call the outside emergency room and tell them that I will not accept this patient onto our psychiatric floor without at least a basic cardiac workup. I tell them his history, that he has only had psychiatric symptoms in the context of delirium from heart failure, and that the little bit of data they actually sent me points to that again recurring. They tell me, okay, they will get the labs and vitals that I requested and reach back out to me. I didn't hear back from them after this, and I assumed that they had found evidence of cardiovascular decompensation and reached out to the medicine floor to transfer him there instead. So I'm going about my night, and a couple hours later, I get a call to come evaluate someone in the ED. I'm down there and using one of the computers at their desk when I hear one of the ED doctors mention something about a patient coming into medicine from the same hospital. For anyone unfamiliar, transfers to the VA pass through the ED first, despite this literally being illegal to do in other hospitals. I don't understand the reasoning behind it, but it's what they do. Curious, I ask if it's a guy coming in with decompensated heart failure. I am informed that not only is it the same guy who will probably be getting a psych consult for delirium, but that he had actively been having a frickin' heart attack in their ED. Needless to say, I was pretty upset that this outside ED had tried to send this guy to our psych unit, where it is a lot harder to get other medical treatments, without even getting vital signs on him or realizing that he was having a heart attack. I tell this story to medical students who are rotating through psychiatry all the time to try to hammer home the point that just because someone is acting bizarre doesn't mean that you can just throw the quote-unquote psych patient label on them and ignore everything else. Story 3. I'm the patient in the story. When I was a toddler and started walking, my extended family noticed that I would waddle a lot. My parents didn't really notice it because they grew used to my funny walking. But my grandma and my aunts that saw me so much less often insisted that I had a limp. So my mother asked our pediatrician about it, and he reassured that it was nothing and that it would fix itself while I was growing up. But 1 year had passed and it didn't fix itself. It got more noticeable, actually. My mother asked again to my doctor. She asked for an x-ray to make sure everything was fine, and the doctor yelled at her for wanting to expose me to the rays. He really insisted it was nothing, but referred us to a specialist anyway. The specialist suggested that my parents put some wool around my leg that had the limp, because wool would warm it up and speed up the growing process. Right. My dad finally had enough. It was summer and my regular pediatrician was on holiday. His partner visited me because meanwhile the limping became really bad and my parents wanted another opinion. The new doc measured my legs. There was like a 4 or 5 centimeter difference between the two legs. They sent me to a specialist children's hospital to get it fixed right away. I had severe dysplasia. It was so severe. 3 years and 3 surgeries later, months of physiotherapy to learn to walk again, and I was normal. If the second doc didn't catch it, I would have grown up disabled. He split up with his work partner, the first doctor. Second doc is now my daughter's pediatrician. Yikes. Exposed to x rays that you will no doubt be exposed to at literally any point in your life anyway? What kind of reason is that to even yell at someone? Sounds like a total jerk to me. I'm glad someone caught the issue and it was sorted out while this person was young. Story 4. Rattlesnake bite on a kid. Patient and dad out in the fields near a small town that is several hours away from the nearest big city where I work. Dad takes the child to the ER in the small town with an obvious snake bite. The doctor there says, it's okay, she probably didn't get envenomated. Doesn't give the patient antivenom, which they had at that hospital. And instead of electing to send the child to us by helicopter, he sent her by ambulance. Several hours later, the patient showed up to our hospital coding and ended up passing away. Probably didn't get envenomated? Like, what kind of stupid idea is that? If a tiny child gets bitten by a rattlesnake, you assume they've been envenomated and you treat them as though that had been. That means antivenom, psychological support, etc. Completely absurd. Story 5. Not a doctor, but when I was 16, I was studying to be a nurse, and I got sent on a shadowing/work experience to a nursing home. The worst thing I've seen overlooked is loneliness. There was a resident, I'll call him Mr. R. I had a little free time on my second day, so I went exploring to try and learn the lay of the land. On my walk, I glanced into one of the rooms which had their door open and see this resident inside coughing and hawking up phlegm on his own shirt because he had nothing else to cough into. I run and get him a box of tissues. While he's wiping himself down, I sit opposite of him, waiting in case he needs anything else from me. He sees I'm new, he thanked me for the tissues, and we began talking about the pictures in his room. He told me his life story, about his time in the army, how he met his wife, about how he missed traveling to Sweden every year, all the dogs he'd had throughout his life. He was the first person to talk to me in a friendly manner at the placement, and I really enjoyed chatting with him. He was funny, smart, and overall just a nice person. He had lived a long and interesting life, and since he had no children, it'd been a while since he had spoken to a teenager. After about 20 minutes, a member of staff knocked on the door and told me I was needed. I said goodbye to Mr. R and promised to visit him again during my stay. I thanked him for making me feel so welcome, and he thanked me and began to cry. He said no one had ever done that for him. Mr. R had been at the home for 3 years. In all that time, no one had just sat down and talked to him, asked him questions, and genuinely listened to him, made him laugh, and made him feel heard. I ended up making several formal complaints and inquiries about multiple problems I witnessed and encountered. Manhandling, neglect, unclean environments, belittling language towards residents, and a general lack of care were just a few. It was the first time I had ever been both so heartbroken and so angry. As a caregiver, one of the fundamentals is that you have to care, and for one reason or another, these staff had forgotten. There were a lot of things I saw at that placement that I will remember for the rest of my life, but the hanging feeling of isolation was the worst. Oh man, this one got me, and I don't know how so many people who are disinterested in giving care end up in a career where the whole point is to give a damn about people. I bet this person grew up to be a really good nurse since he or she sounds like Florence freaking Nightingale in their last life. Such a kind soul. Anyway, since you're already here, please don't forget to hit that like button and subscribe to my channel for more heartwarming stories just like this one. And now moving on to the next story. Story 6. Ooh, I got a good one, albeit sad. I was working nights and a patient came in for a nail bed repair under general anesthesia. It was a slow night. As they're anesthetizing him, he aspirates, so we do a chest x-ray to see if he's got anything in his lungs. What we didn't know is that prior to this emergency surgery, he'd been going to his GP for over 6 months, complaining about chest tightness. They'd put him on various different asthma medications, but none had any effect on him. The x-ray showed a massive dark mass in his left lung. We kept him asleep and transferred him to the ICU. His wife and 3-year-old daughter were waiting for him on the ward. We had to tell them where he'd gone, why he'd gone there, and what was going to happen. He passed away from lung cancer within the month. A general anesthetic is absolutely ridiculous for a nail bed repair, but he refused to have it done under local conditions. This man was in his late 20s, a non-smoker, and I couldn't move past the situation for months after it. Story 7. I'm the patient, but it's an important story to tell. From the age of about 17, I started getting regular abdominal pain every day and terrible gut problems. I can't seem to eat much anymore. I get fluctuating trots and constipation. Menstruation gets more and more painful. I start losing enormous amounts despite being incredibly small, less than 5 feet. Now, you would think any doctor worth her salt could figure out it's a gynecological problem. But my doctor, a woman by the way, at the time insisted it was anxiety and said she wouldn't bother testing for or treating a gynecological problem unless I was older and having trouble conceiving. Over the next few years, my gut and uterus symptoms slowly deteriorate. I get bounced around the system to dozens of different specialists. I get told it's just stress, anxiety. Are you pregnant? Are you sure you're not pregnant? Every woman has painful periods. It's just constipation. Take this over the counter product, etc., etc. Meanwhile, my gut function slowly grinds to a halt. A functional gut test took 6 hours to pass an egg sandwich when it should have taken 90 minutes. I weighed only 40 kilograms. It gets so bad, I even start losing bowel control. No treatment seems to work. I was 24 and unable to work because I was literally uncontrollably crapping my pants. Doctors suggest I should maybe seek therapy and suggest I could be exaggerating. Anyway, one day I see a new GP for some regular health tests but get an abnormal pap smear. Within 2 weeks, I went in for an exploratory laparoscopy to rule out cervical cancer, only to discover I am absolutely riddled with endometriosis. On my bowel, on my cervix, on my perineum, on some ligaments, ovarian cysts the size of a tennis ball. It was even in my gallbladder. With excisions plus treatment, I had my gut function back within 3 months, though I'll never be able to have children. If that woman, when I was 17, had just done her damn job, I wouldn't have lost 7 years of my life, my gallbladder, my fertility, and my mental health. This sounds so exhausting and devastating for her. I'm finally glad she was able to get the proper treatment, but damn, so unacceptable that it came so late. Story 8. I'm not a doctor, but a RN. This happened to me, but it isn't nearly as bad as most of the stories on here. When I was in college, I got to where I couldn't swallow. It started with difficulty swallowing, progressed to me having to swallow bites of food multiple times or regurgitating it, and then got to where all I could swallow was broths and mashed potatoes with no chunks. I went to the doctor multiple times and was told every time it was acid reflux and part of my anxiety disorder. I lost 30 pounds, was only 120 when this started, and was just generally miserable. Finally, my grandma was tired of watching me be sick all the time, so she called the GI doctor herself. They said we needed a referral, but she explained the situation and they got me in the next day. Did an endoscopy and my esophagus was 95% occluded at the gastroesophageal sphincter. For some reason, some of my primary doctor's notes ended up in my discharge paperwork. I guess they had to contact her to get my information. And she had told them it was acid reflux and basically I was being overdramatic. She stated she did not recommend them to do the procedure. Needless to say, I switched doctors, which was not a fun year at all. Story 9. Here's my story. A guy came into our ICU and was very septic but still talking. He had visited his primary care MD with complaints of a sore throat for a couple of days. Dismissed without any intervention since he didn't appear to have strep throat or the flu. At this point, he was having pretty severe abdominal discomfort, so we sent him for a CT scan. As the scan was finishing, he coded and had to be intubated, multi-organ failure, etc. The CT scan was horrible. He had all kinds of crap all over his peritoneal cavity. His wife told us that he had choked on an ice cube the day before he saw his primary care MD. Evidently, he swallowed a whole double half-moon shaped ice cube that perforated his esophagus with a huge linear 4.25-inch tear, allowing a significant portion of his swallowed food and drinks to get into his peritoneal cavity instead of his stomach. To make things worse, he had some reflux that allowed stomach acid to get in there as well, likely while he was sleeping. Once we realized what was going on, he went for extensive washout and exploratory surgeries to repair the damage to his esophagus and other organs. Thankfully, he made a full recovery, but he was very close to not making it. Okay, great. Now I need to be scared of eating ice? Story 10. In my psychiatry residency, I was working in the psych ER one night when we got a transfer from the main ER. Her family had brought her in for altered mental status that had been getting gradually worse over the past 2 weeks. She had been cleared by the ER doctors, all labs and vitals had been normal, and I was told she was likely having a mental breakdown or psychotic episode. She was rolled into our area and I went to assess her. She was non responsive, staring off into space, crying and shaking her head back and forth and mumbling. She could not answer any questions and seemed to be having a tremendous amount of anxiety. As a psychiatrist, one of the biggest lessons my mentors taught us was to assume a change in mental status is always a medical condition until proven otherwise, and then you can think about psychiatric causes. Within a couple of seconds of me seeing her, I had a gut feeling this was not psychiatric in nature. I looked through her chart and saw she had a history of clots in the past. Her vitals were rechecked, and again, they were totally normal. At that point, I made an executive decision and ordered a stat CT of her chest looking for a possible clot. The technicians who came to take her for the study were slightly confused as to why a psych resident was ordering this, and the radiology team even called me and wanted to make sure I had not ordered it by mistake. 30 minutes later, I get a call from the on-call radiology resident, and she says, "Are you the psych resident that ordered this CT?" "Yep, that's me." Thinking I was about to get some comments about wasting their time, she continued, "And this patient is in the psych ER?" "Yes." "Well, you better call the ER and have her transferred stat, because this lady has the most massive pulmonary embolism I have ever seen and will likely code any second." So with that, we transferred her back to the ER. She was admitted to the hospital and treated for her clot. Within a few days, she was back to normal. From then on, whenever someone would make a joke about a psychiatrist not being real doctors, I would tell them this story and that would settle it.
Doctors, what was your dumbest, I'm very smart patient experience? Registered nurse here. I see some crazy stuff. The one thing that stands out was the time I was admitting a guy to the hospital. I can't really remember what for, but he was about 400 pounds, diabetic, heart disease, you name it. Anyhow, I'm at the computer going over some admission questions with him, and his 10 family members were crowded in the room with him. A few minutes in, he starts complaining that he's thirsty. He needs something to drink right now. So I get on my phone and call the nurse assistant and ask her to bring in some ice water. As soon as the words are out of my mouth, the whole family screams, "No, no water, he's allergic to water." This is going to be a problem. Turns out the guy had been drinking nothing but Sprite and sweet tea for years because of his water allergy. The next question the wife had was, where are we all supposed to sleep? The whole family, 10 people, were planning to stay at the hospital with him. You can't make this up. They weren't aware that there's water and Sprite and sweet tea. He was drinking so much sugar per day. Can't fathom it. Story 2. I have one. I got this from my friend who is a doctor in the children's ward in a rural hospital. These parents bring in their child whose hair is infested with lice. The lice were visible to the eye and could be seen crawling. While the medical staff examined the child in order to determine a course of action, they discovered the child was covered in a white powder and smells heavily of chemicals. They asked the parents what it was and the smells emanating from the child. The parents said, quite matter of fact, it was 7 powder and flea and tick spray they used in their dogs in the family's farm. Needless to say, social workers were notified about this case. Story 3. I work for an optometrist, and it was the month before school started, and a woman brought in her son to have his eyes checked for the first time. Seems like a pretty reasonable thing for any parent, even if he was a little older than usual for a first eye exam. Better late than never, I guess. The mom was well-spoken and appeared fairly intelligent. Everything went as normal. The doctor examined the boy and ended up prescribing glasses. When the doctor was explaining to the mom that her son had to wear his glasses all the time since he's nearsighted and basically can't see clearly past 5 feet in front of him, I'll definitely need glasses for school. For some reason, this caused the switch to flip on the mom and she spazzed out on the doctor, saying that her son doesn't need glasses and that the doctor is only saying that he does because he wants to sell glasses. She says that she only brought her son in because there was some form for school that needed to be filled out and that doctors are all con artists, trying to push unnecessary medications and interventions. The doctor tried to calm her down and explain that he's only trying to help them, but that she was free to get a second opinion and gave her a copy of the kid's prescription and sent them on their way. About 4 months later, the lady is back asking for another copy of her son's prescription. Apparently, the first semester midterm results were in, and her son failed them all because he couldn't see the board in his classes and needed glasses. Story 4. I'm a dental student. One patient in particular was a pathological liar. During one visit, they claimed to have gone to medical school. Next visit was that they went to the dental army. Last visit was that they had a PhD. The patient will say things like, "Hey doc, do you need me to move my head mesial or distal?" "No, I need you to move your head right." Hey doc, are these cavities being caused by the anaerobic pathology microbes? No, they're caused by you eating snacks all day, not brushing. I'll tell the doctor a couple of medical terms that are totally unrelated to whatever he's doing. Yeah, that'll impress him. Story 5. Oh boy, it's my time to shine. Number 1, a guy brings his wife to the ER. Her leg has a wound, diabetic ulcer. Now I took one look at her and referred her to the surgery department for admission, but the hubby is adamant on his wife's kidney disease. But doc, it's just a wound. You gotta fix her kidney first, doc. I read online that diabetes can cause kidney failure, and you gotta do something for that. I spent an hour convincing him that his wife would probably pass away before the kidney damage set in by sepsis from the clearly infected wound. Number 2. During my pediatric internship period, one day I was in charge of the general ward. Basic things: look after the kids, solve small complaints, cough, breathlessness, etc., evaluate new admissions. Now where I work, interns are supposed to draw samples from children for tests. So I went about my job, and there's one little tyke who's a bit too active and jumps around when he sees the instrument. The mother gives me a vile look and says, "You lot are just using my child for your education." At which point the kid just screams even harder. Yes, I'm studying to draw samples at 2 a.m. by waking up a kid. That's what she thought. Took a fair amount of convincing, too. Number 3. I took care of a child that got measles. The mother and father were strongly anti-vax, but were yelling at me, "How can modern medicine not have a treatment for measles?" At which point I told her there was a preventative method, but you didn't use it. She asked me what it was, to which I replied, "Immunize your child." She said, "You're just one of them pharma lobbyists, aren't you?" Yes, I'm a pharma lobbyist who wants to harm children. Number 4. A lady comes screaming into the ER. Now she's all dressed up, so are her 2 grown daughters. All of them are screaming hysterically that their mother is going to pass away. I go by them and nearly get harmed by the sister-in-law and the husband of one of the daughters. "Save her, she's having an embolism." Shaken, I examined the lady, asked her where she was coming from. A wedding. That explained the dress. She apparently had a bit too much of potatoes. A dose of pantoprazole later, her embolism is gone. She had a bad case of fart embolisms. One thing I will never forget is how I learned never to be mad at a patient. Now this was when I began as an intern. A patient had intestinal obstruction. We inserted a nasal feeding tube as the patient could not have anything per orally before the surgery. Problem was that they would always come and complain to me about how I didn't stick it properly. You have to stick the end protruding out the nose to the nasal bridge. After 2 to 3 such episodes where I reluctantly dressed it, they complained that the tube is out of the nose. Lo and behold, it is out. It's very uncomfortable. Most patients try to pull the nasal tube out. I replaced it like 4 times. Poor guy was fed up by then. On the morning of the surgery, his wife comes and asks me, "Doc, can you just remove that tube so that I can give him some coffee?" Now I got totally mad. I was working a 72-hour shift, so I scolded her by saying that if she or he didn't want the surgery, then I couldn't do anything and it would be nice if they gave me some peace. She didn't say anything. The patient, 50 years old, no other complications, passed away on the table. I couldn't face her. The moral being, doctors know more things than patients, but it's not always wise to annoy them. I could have convinced her it was impossible to remove the tube before surgery in a calm way. Since then, I've tried to be a better speaker to patients. Story 6. Optician here. We had a patient who refused to let us use the tonometer, a machine for checking ocular internal pressure to diagnose glaucoma. He said that the puff machine gives you glaucoma and we weren't going to pull that on him. He told us his father got an exam and had glaucoma after using that machine. His uncle and brother also had no signs of glaucoma, and after getting the puff test, both people had been diagnosed with the disease. Glaucoma doesn't have any outward symptoms before you start going blind. This guy just told me he has a very strong familial disposition to glaucoma and refused to be tested for it. Also, puff isn't that bad, guys. Try contacts. Your eyes stop opposing back pretty quick. The puff is a lot better than the old machine. They also have plenty of patients that don't understand family history. I interview patients directly so we don't have any real paperwork, and too many people can't answer simple questions. Do you or any of your direct family members have diabetes? Yes. Yourself or your family? Alternately, if yes to family members, they start listing their spouse's family or stepchildren. Not how genetic disposition works. Or after getting no answers to diabetes, hypertension, glaucoma, thyroid problem, heart problems, etc., I ask if they take any medications. Yeah, atorvastatin, thyroidazine, metformin, and low-dose aspirin. Oh, so you have everything I asked about. Check. Want some more? Way too many people don't understand presbyopia. As you age, your lens hardens and can't focus up close anymore. Of course, when this is explained, I get a lot of people who believe they're way too young for bifocals. No, 60 is not too young for bifocals. Why doesn't the doctor have to wear bifocals? He does. He's wearing progressives, you don't see the line. Or after trying to get used to multifocal lenses for a few days, giving up and demanding we remake them as single vision, and then getting mad at me again when they can't read with them. I never needed bifocals before, why can't you just make me regular glasses? Regular glasses always work just fine. Yeah, you used to be 20. Also, you came to see us because you can't read with your regular glasses. In the same vein, these same people complain about their own insurance to me because progressives are expensive. The line bifocal is covered entirely. Progressives cost a lot. I can't have lines in my glasses like an old person. Then you want progressives. This easily triples the bill. Why are you so expensive? I need to be able to see. Yeah, you need a bifocal. You don't need a progressive, you want a progressive. Insurance pays for what you need, not want. I actually had a guy make me talk to his insurance agent about him needing medical necessary progressives. A progressive lens is never medically necessary. Stop being cheap and listen to what I say. I'm not a salesman. I'm a medical professional. Stop acting like you know better than me. Story 7. Not a doctor, but a patient whose mother was like this. The doctor had to speak to me on the side because of it. My grandmother has Crohn's disease. Very, very badly. It skipped my mother and her brother. When I was a teenager, over the course of 6 months, I went from being 5'9" and 190 pounds to being 110. I was a skeleton, extremely anemic and coughing up red liquids. My mother was convinced it was something else. I forced her to bring me to a doctor and she spouted off all these possibilities. She then talked about what she Yahooed, not even Googled, Yahoo, about genetics and such. And Crohn's can't skip generations. Well, the doc said, just in case, we're going to run some tests. Long story short, I have Crohn's in my throat and small intestine. So does my cousin. It just skipped a generation. Story 8. Oh, I have 2 good ones that come to mind. Clinical pharmacist here, by the way, with 1 story in the ER and 1 in the pharmacy. The ER physician told me this. A young boy presented to the ER with an extremely swollen discolored Johnson. Apparently, he has been using his mom's insulin to draw samples out of his arm and inject it into his own. He thought that adding samples would help increase his size. He was terribly infected and he was hospitalized for a week or so. One day in the pharmacy, a girl comes to the counter requesting a refill for her birth control. We pulled up her profile and realized we couldn't refill it because she just got a 28-day fill less than 2 weeks ago. When we asked what happened to the other one, she said she was out. Apparently, both her and her boyfriend were each taking a pill each, and was adamant that was how they needed to prevent pregnancy. I hope she gave all the birth control. The spawn of those 2 may have been a disaster. Story 9. My dad is an emergency nurse. He experiences the same thing doctors in the ER do, maybe more so because he's the one in the rooms more often. Anyway, here's a good story from him. I had a patient come in with several pages he printed off the internet. He kind of put them down and said, "This is what I have." He had bloating, nausea, vomiting, diarrhea, and fever, among other things. He insisted he had schistosomiasis. He was being a real schmuck about it, like we're wasting time since he already knew what he had. So I asked, when did he get back from Africa? And he said, Africa? I've never been to Africa. What the hell would I be doing in Africa? I proceeded to tell him that schistosomiasis is a parasitic disease one gets while swimming in the Nile River or other rivers in developing countries like in the Southeast Asia. He got pissed off at me because he thought I was being smart. He got seen and diagnosed with gastroenteritis. The stomach flu. Story 10. Dental nurse here. Asked a patient to fill out her medical history and asked her to just tick alongside the company's set medical history. Not that intrusive, just medical stuff we as dentists or nurses need to know. As she stated she was pregnant, I ticked the non-smoker and non-drinker box for her. She said no to all the questions as I went through them. Her previous forms all said she had never smoked or drank. No lie, this woman literally flipped, telling me I had no right to do this. I mean, you're pregnant, so you shouldn't smoke or drink, right? So I just get her a new form and she ticks that she drinks roughly 10 units a day and smokes 20 a day. I asked her if she does this while pregnant, and she said that she has smoked and drank through all her pregnancies and they were all healthy. She stated there was no scientific or medical information on the dangers of it. I literally didn't know what to say. As a dental nurse, all I was able to say was it's really bad for your gums and teeth and general oral health, not the fact you're damaging your children. As for the children's medical history, all 3 had some kind of syndrome. She was adamant this was untrue and the doctors lied about this. And one had a birth defect which is related to smoking during pregnancy. The patient was in for treatment for fillings. She was a week prior and failed to inform us she was pregnant at the visit. She also agreed for me to take the form while she spoke the answers to me at both visits. Yes, it is wrong to assume she didn't smoke or drink while pregnant. Story 11. Patient had a hard time getting pregnant. Finally conceived but miscarried. Patient has a DNC, so she can try again, this time with medical intervention. We monitor her to ensure the pregnancy hormone is gone before beginning treatment, but she keeps coming back with high levels of hormones. Docs are worried because she might have some retained placenta or pituitary disorder, and this could be super bad for future fertility. We call her in for a conversation about the hormone levels not going away. After talking together about what might be wrong, they are going to go home and think about further tests. She says, "I need to go. I have an appointment at the weight loss center for an HCG shot." Turns out that she's on the HCG diet. HCG is the pregnancy hormone. This was after an hour of the doc saying, "We don't know why you have these constant high levels of HCG in you, and we're worried." Story 12. My aunt, who has varicose veins, pretty obvious to anyone who sees it, once asked me why her legs hurt and what those bluish lines under her skin were. I almost went on to explain to her about dilated veins when she interrupts and decides for herself that those are her nerves. Near-ending nerves. And this blue stuff was clots inside the nerves. I'm a med student. I was doing a respiratory system examination in this guy who frequently, though once a month, gets admitted to the general ward with complaints of breathlessness. He's had COPD for a couple of years. Quite bad. And he tells me that he isn't going to quit smoking because God told him not to. When asked why, he tells me that the people who are relying on him for their daily livelihood won't survive if he stopped. I went on to ask him if he meant the people at the cigarette factory or the health industry. He didn't get the sarcasm, though. Patient comes to the surgery clinic with complaints of a mass. Now, I wasn't there the first time he came, but the surgeon wanted to do a couple of investigations and advised him to get admitted. The guy decided he doesn't want to. A couple of months later, he comes back to the clinic. Apparently, he went to one of these alternative medicine places or whatever, and they had tied this metal wire, not exactly sure why, around the mass. By then, this mass had eroded through it and had gotten much bigger. It turned out to be a cancerous growth. Story 13. Not a medical doctor, I'm a registered nurse that works with oncology, cancer patients, some of which are in clinical trials. I got a patient and, before starting his chemotherapy, reviewed some of his lab work with him. I told him his glucose level was 73. Normal range is usually between 70 to 100. He got really upset at this point and asked him, "What's wrong? Your labs are within range." And he said, "I need it to be 0. I said, "What? Why would you want your glucose to be 0? He said he's trying to meet requirements for a new clinical trial that requires his glucose to be 0. I told him, "I don't know what clinical trial you're trying to get into, but if your glucose was 0, you'd be gone." He was not convinced because I'm just a nurse. So I sent a message to his medical doctor asking them to educate their patients better. Story 14. I recently had a 30-year-old insulin-dependent male argue he knows when to take his sugar medicine. He had bilateral retinopathy and a severe vitreous heme in one eye. Legally blind. Driving a car last eye check 8 years ago. Lost glasses 2 years ago. Will need 4 or more surgeries, including an inevitable cataract. I had a patient tell me they clean their contact lens with milk because it gets the dirt off them. I had a patient ask me if it was alright to look briefly at the sun for short periods of time to improve their eyes. I was amazed and kindly suggested they don't. Had a patient put eardrops in one eye, white part of the eye, conjunctiva, scarred over the entire cornea and was left with no light perception. Asked me if he should have come in sooner. It had been 4 months. He needs a cornea transplant, which will take over a year to recover from. Patient with a retinal detachment told me to put more medicine in the glasses to see better. Macula was off, so they could barely count fingers 4 feet in front of face. Had a patient wear contacts designed for 2-week daily wear, leave for 8 months. They literally grew into and became part of the eye. It was repulsive. Had a patient, basically no clue besides eye hurts. Her hand covered her eye. I asked to see the problem. Her eyes looked like a shriveled up grape. She wanted glasses. Had a lady put jock itch in her eye to cure her suspected fungus. Asked her why she thought it was a fungal infection and she just had an inkling. They are rare. Cataracts in a 58-year-old male working rooftops for 30 years with no sunglasses. Best corrected vision was counting fingers 6 feet one eye, barely seeing better in other. First eye exam. Mad when I told he needs surgery and should not drive a car. Had a patient tell me the benefits of using alcohol wipes to clean herself. Out of the blue. I'm an eye doctor. Had a guy clean his contacts in the shower with shampoo because he was convinced it was better. Red eyes 2 weeks later. Homemade contact solutions are always fun to hear. Vinegar, salt water. It is not cleaner than fresh solution, but please, tell me more. A guy recently came in because wife made me. Tried with tweezers to remove metal from cornea. Didn't look pretty. I removed the remaining metal rust with a needle and spinning burr tip brush. Told him not to do that again. I had a patient walk in one day with no glasses or contacts. Had a full penetrating cornea transplant, both eyes, 17 years ago. Last eye exam was 12 years ago. Swore he could see fine. Clearly a transplant graft rejected one eye with no functional vision and the other was gnarly looking good eye. I barely got him seeing with glasses on one eye and can't drive. I control diabetes too. Messy. I've had more than one patient argue with me about not seeing right. They either had 2 or more contacts in their eyes or none at all. When they try to remove a contact that is not there, it causes a painful abrasion. Multiple women using non-approved glues to glue on fake eyelashes. Leaks and hurts the eyes. Just why? Using fake contacts from the nail salon. And it never ceases to amaze me when I hear, I just use the same solution until it turns brown or black. Every day. I have to convince a lot of people not to use hand sanitizer in their eyes. Way too many, actually. I had a patient not taking her herpetic eye drops because she just wanted to pray instead. Luckily, I convinced her to do both medicine and pray. I could go on and on. Actually, I was really invested in that. Anyways, if you're enjoying the video, don't forget to hit that subscribe and like button for more videos like this. Story 15. Obligatory, not a doctor, but I am a medic. Back when the Ebola crisis was huge and the media was losing themselves over it, I had a very interesting call. There are definitely other very smart instances, but this was at the forefront of my mind and it makes me both laugh and cringe at the same time. We were riding 3 deep, all-female crew, dispatched to a sketchy part of town in a bad apartment complex for unknown problems. Okay. I'm taking the back seat in this one, kind of just going to observe. We're met at the ambulance by a late 50s, early 60s African-American male. Unkempt, yellow eyes, clothes that look like they've been slept in for a week, dirty nails, general uncleanliness. He asked us in a very thick accent where the men were. There are no men, it's just us. We all have the same training. If you're more comfortable with a man, we can get a male crew here, but they won't do anything different than we will. Women can be in male positions. You should all be home taking care of your husbands and children. One of these people. I respect and get cultural differences, but sheesh, it gets old. After going back and forth for a few minutes about our training and trying to explain to him in futility that none of us, at the time, were married or had kids, we finally told him, look, we aren't here to discuss ourselves. We're here to help you. You called us. What made you hurt so bad to call 911? We have to assess you. We can't just get another crew over here not knowing what the problem is. What issue are you having? My Jimmy, I think I have Ebola. Cue the eye rolls. You have Ebola in your Jimmy? I said. It wasn't a question. Yeah, I just came back from Liberia last week and haven't whizzed in 4 days. Cue him spewing all tons of what his culture says about illness. We wound up ignoring him and continuing our assessment. He was so adamant about it, though. Cited obviously fake odds and facts and bragged he had been intimate with several women in Liberia and that's how he got Ebola. Okay. Are you in pain? Can we take a look? He let us get a set of vitals, but then he pulled it down, conveniently forgetting his request for men and apparently the fact that all of us knew nothing and should be taking care of our husbands or whatever. His jewels were the size of grapefruits, so the dude was legit. He definitely had some issues going on. He was convinced he had Ebola, only in his Jimmy. Also, I'm sure he was more shocked that we weren't fawning over it, us being a crew of women. I should note this dude very much did not have Ebola at all. We took him to the hospital, and when we told the receiving nurse what the chief complaint was, she brought the doctor over and asked us to tell him to his face what the patient was complaining about. When we went back dropping off another patient, we asked how patient 0 was. They had to stick a catheter down to drain the whiz, but he definitely was riddled with STDs. I don't know if this classifies as I'm very smart material, but I thought it was relevant. Story 16. Most of my own stories go along similar lines to patient has chest pain driving a coachload of school children, think it's indigestion, swigs bottle of Gaviscon, later diagnosed with a huge heart emergency. My favorite ever story from a colleague. A patient comes into A&E with abdominal pain. As part of the workup, he gets an abdominal x-ray which shows the problem as clear as day. The colleague has then proceeded to remove from the patient's an 8-inch replica of Nelson's column, the statue in the center of Trafalgar Square, London. When showing it to the patient, the response was, "Oh, that's Nelson. He lives up there." Story 17. Not a doctor, but a gastro nurse. We had a recurring patient who was just a really very strange lady. She had a stoma that absolutely stunk to high heavens because for the last 20 years, she's not been cleaning it properly. Every single day, her stoma would come off because she was twisting the drain tube and wouldn't allow us to change it. So this lady was really rude and would shout at us too. One night shift, I couldn't take it anymore and I snapped at her. I didn't yell, but I was overly stern about the fact that if she did not let me clean and treat her stoma, then the MRSA that she wasn't able to get rid of because she refused Hibby scrub washes. In hindsight, I didn't handle that very well, but she let me change the stoma. So this entire ordeal, she's yelling at me that her stoma bags do not fit her stoma, that they're too small because her stoma is 50 cm by 50 cm, to which I corrected her, saying it's impossible. She was adamant that's how big her stoma was. It was a 30 millimeter diameter. When I was cleaning the stoma, she yelled at me because it was hurting, so she wanted to just pop the new one on. I explained it was hurting because of infection as she never cleans it. She proceeds to tell me that she knows better because she has had the stoma for nearly as long as I've been alive. I eventually ended up telling her to shut up and let me do my job, which seemed to work. The stoma did not come off again that shift. When she was eventually discharged, she refused every placement to the point where we almost considered a court order to evict her. One of our F1s nearly cried with relief. Story 18. Not a doctor, I'm an optician, and at this point, I was a young lady in my mid-20s. I had a guy come in saying he was a doctor and he wrote himself a prescription for glasses and he bought frames. A few days later, his lenses come back, he puts on his glasses and he can't see. I start going through the possibilities. Usually with progressive lenses, it's an adjustment issue and they need to sit differently on his face. He completely refuses to let me adjust them. So I check the lenses and the prescription matches what he wrote. I try to explain that there's only two options. Either they need to sit differently on his face or the prescription isn't good. He tells me, "You don't understand. I've had eye surgery for a disease they've never even heard of." I offer to remake his lenses to prove a point. His new lenses come in a few days later. An older coworker is helping him. I told her everything. Again, he can't see. She tells him, "The young girl who tried to help you last time was trying to explain that if we adjust your glasses, you might be able to see out of them. Will you please let me try?" He lets her, and suddenly, he can see. Granted, not perfectly because he wrote his own prescription and the bottom sentence will explain more. Turns out he was a lung doctor, not even an eye doctor. Story 19. Was treating cavities in a very nervous kid. Had finally gone into a cooperative groove when the genius mother looked up from her phone and noticed that I was excavating his teeth. She was in the room the whole time. I had reviewed treatment with her. She knew we were fixing cavities. Proceeds to badmouth me under her breath, saying, "You're making holes in our teeth. This is ridiculous. You people are scammers making holes in people's teeth." I kept my calm and said, "Ma'am, if you have questions, I will be happy to answer after I'm finished." I'm shaking with rage at this point because she was 20 minutes late to her appointment and I'm bending over backwards to make sure her kid has a good visit and doesn't end up scared of the dentist. Appointment is over. The kid jumps down, high fives, and gives me a big hug, and I turn to Mom and ask her how exactly she thought cavities were fixed. She said, "You don't make holes. My mother is a dental assistant." I then proceeded to explain in excruciating detail the scientific process of how we remove decay. She said, "That's not true." I then told her that she can go ask her mom, ask Google, or go to dental school if she wants to know more, but I won't be treating her child anymore. Story 20. I was a unit secretary and nurse aide in a radiation oncology unit in the early 2000s. We had a patient show up through the ER and was admitted for emergency radiation treatment. She had a massive mass in her mouth. When the rad onc doc tried to examine her and open her mouth, her remaining teeth fell out into his hand. Doc said it was the worst case of mouth cancer he'd seen. According to her husband, she had a small lesion in her hard palate, and upon receiving the diagnosis of an early-stage squamous cell carcinoma, she decided to treat with essential oils and things like frankincense because chemo was not an option. Her husband said he had tried to reason with her, but she was adamant about the natural treatment. She passed away in agony shortly after. Story 21. Optometrist here. Had a 38-year-old female patient coming in for a routine eye exam. Asked her all the usual background health questions. She had checked off migraines 20 times in her health history. Whenever anybody mentions they have headaches, I always ask for more details. She said she had migraines every day since high school. I was a bit confused. I said, "Every day?" And she said, "Yep." I asked further about her diagnosis of these, and she said she's just seen regular family practice doctors and even a neurologist. I asked her to describe the headaches in detail, how long they are, where in the head, what time of day, etc. She got irritated with me and said, "Aren't we supposed to be doing a simple eye exam? These headaches don't have anything to do with my eyes. They're migraines." At that point, I stopped asking questions and silently hid my anger with her and just did the eye exam. Near the end of the exam, I noticed her optic nerves were swollen. I explained that swollen optic nerves require urgent referral for imaging of the brain. CT, MRI need to be done first and other testing if there's nothing found. They came back clean. I ordered a lumbar puncture after that, and her cerebrospinal fluid pressure came back 3 times higher than normal. She was put on a medicine to bring it back to normal, and her unquestionable diagnosis of migraines that she had every day for 20 years were instantly cured. Story 22. I don't know if this fits perfectly, but a while back I helped open an urgent care for the first 2 years. When we first opened the doors, one of our first customers was an 85-year-old adorable Asian lady who was really hard to understand but talked a lot. Anyway, this lady came in for the first time complaining of stomach pain. We attempted to diagnose her with something, but nothing added up for about 30 minutes to an hour of her talking until she finally told us she just felt better. Okay, so we don't really mind it until next week around the same time she shows up again with the same problem. And guess what the solution was? About 45 minutes of listening to what she ate for dinner the last few nights. I think we eventually figured out corn was messing with her, but this never deterred her from coming in more. This eventually became a once-a-week occurrence, then a once-every-day thing, until we finally started becoming a busy urgent care and we couldn't really fit her inside a schedule. I guess it wasn't really an I am very smart experience, but I swear this lady actually came in every day thinking she was on the verge of ending, until we had convinced her she's fine. In case you're wondering, I'm almost certain she's well over 90 now and still going. Another possibility is that she's faking and just wants someone to talk to. Story 23. I'm still just a medical student, but our hospital sees a lot of poor and poorly educated patients since we're a big tertiary hospital in a developing country. Worst I've seen so far are the old ladies who everyone in the family turns to for health advice, their only qualification being seniority. They usually have a bunch of superstitions that end up contributing to the patient's condition in the first place. I once saw a neonate brought to the ER for a really bad oral infection, and the mother clearly hadn't taken a bath since the delivery. It's a common superstition here that mothers shouldn't take a bath a week or so postpartum, so we figured that's the source of the infection. While we're assessing the patient, the doting grandmother in the background decides she has to comment on everything we're doing. Remember, she's probably the one who advised her daughter not to take a bath. I just had to shut her down because A, it was late and people were running out of patients in our understaffed, under-equipped ER. B, they're more worried that pulse oximetry is hurting the baby's tiny little toes. To get that infections like these are a disease of poverty, that their poor education is just indicative of a wider systemic problem that Philippine society fails to address time and again. But by golly, does it get annoying. Story 24. It happened almost a year ago. I just finished my MBBS and I was interning at the same hospital I graduated from. As part of our internship program, I was posted in a small clinic that deals with small medical issues which don't require any major investigations. So one evening, this guy walks in with a complaint of neck pain from the morning of that day. After asking a few questions, it was clear that he slept in a weird position which was the cause of the pain. I tried to explain to him that the pain is temporary and there really is no need for him to take any medication. It was a government clinic and we were running short of supplies. But the guy was adamant in getting medication. So I prescribed one. And since this particular medicine was known to cause gastritis, I also prescribed a medicine called ranitidine, sold as a popular brand name called Rantac in India as well. This guy knew that Rantac was something that doctors prescribe for stomach pain, and he had no idea what the other one does. But once he saw that I had prescribed Rantac, he threw the prescription literally on the floor and started to complain to the nurse that we, my friend and I, didn't know anything and that we had prescribed a medicine for stomach pain when his complaint was neck pain. I turned to the nurse and just explained to her why I did what I did, and once he heard that, he silently took his prescription and walked away from there. Story 25. I'm not a doctor. I'm a student physical therapist, and while my story does not match up to some or most of the ones here, it's still worth telling. Over the summer that just passed, I was doing my orthopedic internship, working with a female patient, early 60s, just moved into a senior living community but hated the label it gave her and liked being really active. Bike riding, walking, golf, etc. She's at the clinic for a right meniscus tear, and it's trying the conservative approach to avoid having to get surgery in her arthritic knee. Now we need to emphasize that these women loved being active. Like, even during therapy, she would keep up her golfing, pickleball, etc. I would always remind her to not do so much, to let the knee heal and to focus on her exercises, and to lay off those high-stress activities. No matter how much I told her to do less or stop altogether, she just continued to play. I couldn't stop her, so instead of ruining my rapport with her, I just reminded her at every session we had. Well, one fine session comes along. She tells me her knee is hurting a bit extra. Surprise, surprise. After playing pickleball all weekend long, I told her once again to lay off those activities and to avoid golfing tomorrow. She would golf on Tuesdays. Of course, she says no, and follows up with this. Golfing takes the stress of the knee with how it moves during your swing, so it's good I'm doing that. Except it doesn't. Literally, 3 special tests used in examination to assess the presence of a meniscal tear mimic the motion done by the back leg in a golf stance. I just smile and say, okay, while I'm internally screaming inside. This was also during my last week of the internship, so when I saw her again later that week, I became a bit more adamant about her activity level and her condition. I handed her an article about meniscal tears and the involvement of the rotational aspect that can lead to further tears, told her that while I know I can't convince her to quit all her hobbies, that she has to stop most of them or she will never recover conservatively, and that she can absolutely replace it with a water aerobics class that our community runs. Story 26. I work in physical therapy and often get expert patients who don't want to trust my judgment as a clinician. They are so certain that their doctor gave them instructions that are far from what is clinically safe or recommended. Then, when presented with a kind but stern response, they want to make it seem like I haven't been licensed for many years and or maybe an expert in the area. At this point in my career, I've seen hundreds of hip and knee replacements and have even spoke to most of the big-name orthopedic surgeons in my area. I know what I'm doing, and I know what these surgeons expect of me during my physical therapy. If we don't get the right outcomes, they will not send patients to us. It's important that we know what we are doing to ensure job security. I had one last week that was giving my coworker a hard time over their weight-bearing status, so I stepped in and told them that we have to follow the most recent doctor's orders, regardless of any verbal orders a patient receives. If the doctor didn't transcribe an order, it's for all intents and purposes not valid. This patient was so sure of themselves, so I called the orthopedist and speaker to confirm the order. The orthopedist was very mad that they were lying to us and scolded the patient. Apparently, they had been pressuring the doctor for increased weight bearing to progress their walking, but the doctor had wanted to play it conservative and limit weight bearing for a few more days or weeks. It was pretty gratifying to watch their reaction and see them scolded for lying. Story 27. Pediatric registered nurse here. Had a patient with severe status asthmaticus, continual asthma attacks, admitted as an inpatient. The standard treatment for this is albuterol, among other meds like racemic epinephrine, delivered by a face mask. The face mask is important to actually get the medicine to the patient, otherwise the patient will get next to no medication and it's a useless treatment. Typically kids dislike the face mask, struggle and cry, and the parents or staff have to hold their arms and legs. These parents refuse the albuterol treatment, which would help their child breathe, because the kid cried with a face mask on. Patient ended up okay to the extent of my knowledge, but I was floating at the time so I never saw them again. I do know the physician eventually went against facility protocol and allowed respiratory therapy to go by, which means they hold the albuterol a few inches from their face and hope that they get the medicine. They figured at least they get some medication, however small of an amount, rather than nothing. Had another situation in the neonatal intensive care unit in which parents were refusing a transfusion. I watched the physician flat out tell them she would take emergency custody of the baby and give the transfusion anyways, which physicians are absolutely allowed to do, at least in GA, if they believe a child would be in trouble without it. The parents agreed after that. Of course, the families were always educated about the consequences of their decisions, risks and benefits, etc., etc. Sometimes it's totally useless because apparently Facebook is more reputable than my degree and the degree of the physician. It can be infuriating. Story 28. Well, standard, I am not a doctor opening. However, we did have a patient at my hospital who was a formal mental health patient, i.e. he's not allowed to leave without a doctor clearing him, certificates to be renewed on a regular basis and reviewed by a mental health review panel. Anyway, he was severely sick, enough so that he had to be moved to a secure unit until his medication regime could be sorted out. His family were of the mind that mental health is a legitimate thing, but could never happen to one of them. Our family is of good genetic lineage, etc., etc. They were insistent that his symptoms were from Lyme disease and were on a crusade to find a doctor who would treat him for that. Granted, Lyme disease is often overlooked in my province as we have very few ticks, but he'd been checked multiple times for ticks, and his symptoms were much more in line with mental health. It got to the point that they were quite specific about coming down to the hospital and removing him. Management ended up banning the family from setting foot in the facility property until a written agreement could be reached regarding how many of them would be allowed to attend at a time to visit. The visits would be in a secure area, they would be escorted to and from the secure unit by security, etc. Overall, it was very sad. I'm not sure what the eventual prognosis was for the young man, but I hope he gets the help he needs. And I hope once stabilized, he has the insight to recognize how delusional his family is.
Doctors and nurses. Have you ever witnessed a couple have a child that was obviously not the father's? If so, what happened? Not a doctor or nurse, but My ex-girlfriend delivered a baby while I was in the delivery room, and turns out it wasn't mine. She was 16. I was 15. All along, I was under the impression that this kid was mine and time to be an adult. Took all the classes, read the books, worked every night and weekend to save whatever money I could as a 15-year-old. I finally got the call that she's in labor, so I have somebody rush me to the ER. Luckily for her, it wasn't a long labor, only about 6 hours. But there was a complication. Doctor assured us it was going to be okay, but the nurses were prepping for things to go south. Baby comes out. It's a light shade of purple, and the nurses immediately take the baby and put on the smallest mask you've ever seen to help it get oxygen, I guess. I was too panicked to ask a lot of questions. They state they need to keep the baby on watch overnight, so I stay in the room with the ex. The next evening, baby is back in the room with us, and all seems well. The ex is asleep, and the same nurse from the night before comes into the room and beckons me out. She states that at risk of her losing her job, she has to break some harsh news to me. That kid is not mine. She stated that while at this stage it wasn't obvious, over the next few weeks it would become clear this kid was mixed, and since both of us were white, it was a high probability that it wasn't mine. Cue a mixed bag of emotions and me promptly waking the ex to get a little clarification. Come to find out she knew the chances and was hoping it was mine because it worked better for her. Apparently, her father was an old-school racist and she didn't want to have to deal with that. I left the hospital to collect my thoughts, and a few weeks later was served with child support papers. One DNA test, and about 6 weeks later, I am 0.0% that kid's father. Wherever that nurse is now, I hope your life is amazing. I understand that you were not supposed to get involved in the personal side of things and keep it professional, but you saved me a lot of additional headaches. Sometimes doing the human thing to do is better than the professional thing to do. Story 2. Similar, but I don't know where else to put it because it just makes me laugh. My aunt is a nurse in the maternity ward. She had a couple come in where they were both very black. Lady has baby and it is white as heck, like totally pale, no trace of any pigment. They put the baby on her mom and the mom starts yelling about how this isn't her baby and they stole her baby. In all fairness, you can be very confused during and after delivery. It wasn't stupidity. Just sobbing and freaking out, and the father is just sitting there and looks very confused because even he's realizing that even if she did cheat, there's no way the baby would be that white. The doctor and nurses are trying to assure her that this is her baby and the skin usually darkens later. Come to find out when he called his mom, she pointed out that they have a second cousin who is albino and maybe baby got that gene. Turns out that's what happened. Baby was albino. Can't you tell, though, that a baby is albino? Story 3. I know a girl who was pregnant with her boyfriend's best friend's baby. I found out there was a possibility about a week before she gave birth. I went up to see her once he was born and he looked just like the friend. There was no question. I broke the news to her boyfriend and he was absolutely devastated. His parents were heartbroken and super angry. They'd bought the girl everything she needed, including a $500 car seat or stroller set. She refused to give anything back. She started up a relationship with a friend immediately after having their child, and they're still together a decade later. But the kicker for me has always been that the boyfriend and best friend were next-door neighbors. She moved into his house after coming home from the hospital, so her ex-boyfriend and his family had to see them basically every day, raising this child that they had believed to be his for the entire pregnancy. I can't even imagine. And they had the audacity to stay there. Wow. Story 4. My fiancé's father is almost certainly not his biological dad. His mom was just a genuinely terrible human being who didn't even try to hide the fact she was cheating. But his dad loved him from the second he was born, and when the mom decided 4 years later she just didn't want the kid anymore, she just gave him to his dad and rode off. Jay's dad ended up getting married, and they tried for kids before finding out his count was too low to ever father children. They ended up adopting many years later. He sat my fiancé down when my fiancé was 13 and told him the truth and that if Jay wanted to test, Jay would, but it was up to him. Jay cried and told him he just wanted him to be his dad, and that was the end of that. Enough to make a grown man cry. Jeez. Story 5. I worked as a lab tech before I became a nurse. We had a set of twins in the NICU that were super early, and the mom was still in the OR from the cesarean. I was drawing baby B samples when mom was wheeled over to baby A's isolate. She was crying and said, "Oh, thank God you're not black. I've been so worried for the last 7 months." So newborn babies, especially when they're born early, are very pink, almost red. So even if a baby was part black, their skin isn't necessarily dark yet. But looking at these babies, it was obvious they were going to be black. The shape of the face, the texture of the hair, and baby B that I was working on had an intense Mongolian spot. A few weeks later, my NICU nurse friend told me that the babies were now on a no info status, meaning security alert. Can't give anyone information about them, can't refer to them by name, etc. She said there was a huge fight because the mom's husband, white guy, obviously noticed that the babies were half black and that mom had cheated on him and got pregnant. The real dad, black guy, came in and didn't realize the mom was even married. Those poor babies. Story 6. I had the opposite happen, sort of. My wife and I are both brown-skinned, dark-haired, half Mexicans, and our moms are both 100% white blondes with blue and green eyes. So we sort of knew it was a crapshoot with our baby, but the nurse who was assisting with delivery had no idea. At one point, she gets sort of nervous and calls for help, and another, I guess, more senior nurse came in and nodded and came over to talk to me. I thought there was something wrong with the baby as she came over and stumbled through some questions. So I was the father and no one else was coming, etc. Then finally, she awkwardly asks if either of us happened to be blonde growing up. I said, yeah, I was, and both the baby's grandparents are blonde as they come, and this wave of relief went over her, and she brought me over to see this blonde-as-heck crowning baby head. It's funny because he looks just like me if you applied a Instagram filter. You often get awkward questions about his heritage, and my wife always hits them with, yeah, we're not sure if he's mine. And it's always funny to see people nod for a moment and then go, wait, what? Story 7. I had a college buddy whose fiancée was pregnant. They were the perfect couple. Both had just over a year with great careers starting out. Everything was butterflies and rainbows. Fast forward to the delivery room. They're in there, and out comes a very black baby. He's quite the pale redhead, and she's a blonde, blue-eyed Texas girl. He made sure everyone was okay, waited for her parents to arrive, and left without saying a word. He moved all his stuff out of the house while she was in the hospital and cut off all communications with her. Just walked out of their lives in the most stone-cold act I'd ever seen. They were together for 9 years, and he just left cold turkey. She tried to contact him at his job a few times, but he quickly moved up the ladder and eventually got a job in another city. He told me once that he took solace in the fact that her family had already dropped about $10,000 in a wedding that never happened. Can't say I blame the guy. Story 8. I used to work with a guy whose wife was pregnant. Near time for delivery, everyone at our place of business had a big party with gifts, money, etc. So big day comes. Water breaks, they get in the car to go to the hospital. She breaks the news on the way there. It's not his. The kid has another race, and if he could just drop her off at the hospital and then leave, that would be great. I took a few days off work, found a new apartment, moved out, filed divorce, etc. He called into work and told someone what happened. News spread pretty fast. All congratulations cards, etc. were cleaned up and thrown away. Everyone was very sensitive to his pain. Except somehow, I don't know how, I did not get the news. So on his first day back, I walked into the office he shared with 6 to 7 other guys and said, Hey, Daddy-o. How's fatherhood so far? Getting any sleep? Got some pictures? Let's see the little tyke. He slowly lifted his head to look at me with a painful look. The room was completely silent. One of his workmates stood up, grabbed my arm, and walked me out of the room, shushing me. What happened? I asked. Did it pass away? What's the problem? When he told me, I about passed myself. I still feel bad for the dude, and it's been 30 years. Story 9. Coworker of mine is a notorious compulsive liar, and we all know better than to believe a word that comes out of her mouth, but I hope like hell that this story is true because it's so freaking good. So this coworker, who's 19, is bisexual. Her wife is not, was her best friend from childhood. When they were both 18, the best friend proposed to her because she wanted the stability of a relationship. Coworker agreed, and they got married, but they both then decided that she couldn't live without intimacy, so they worked out an open marriage. The only caveat was that they had to tell each other who they were sleeping with and when, and they had to be smart about it all. Well, wife comes to coworker one day and tells her that they're going to have a baby. Coworker says that it is pretty much impossible since they both only have half of the baby-making equipment. Coworker has also not heard that the wife has been sleeping with anyone recently. Wife is then forced to admit that she's been having an unmentioned affair with coworker's twin brother. In that since he's the only man she's sleeping with, he's the father. Coworker calls her lawyer that day, and lawyer has divorce papers drawn up by 9 p.m. to serve the wife with the next day. I was about 70% on board with this story, because again, we're dealing with a known compulsive liar. Up until that detail. This all went down on a Sunday. I'll admit that I don't know much about lawyers, but I doubt that they're going to prioritize a 19-year-old's divorce papers over enjoying their weekend. The best part was that I went on break about 5 minutes after she did, and she was on a phone call, or pretended to be on one, with her lawyer for half her break. None of this was ever mentioned again. Yeah, she was definitely BSing you. Story 10. Happened to my fiancé's mom. His mom is a labor and delivery nurse. One time she had a patient whose parents were present during her stay at the hospital. The staff there have a whiteboard with some general information about the patients. This information is nameless for HIPAA reasons and instead has a patient's number. So this patient had to be the only one in the wing at the time. Their father was walking back from the cafeteria at one point and noticed the board. He stopped one of the nurses and asked if the type of the patient on board was correct. He knew his daughter was the only patient there. It was B+. The nurse confirmed it was correct. Turns out he knew his and his wife's type. He was O positive and his wife was A negative. This combination will never yield a B positive baby. He brings his wife out and just points at the board, and this look of shock washes over her. That was a really good gotcha moment. Story 11. Not quite what you're asking, but in the same vein. I'm a nurse in a level 4 neonatal ICU. We service the sickest of the sick from our state and the surrounding states, so we see it all. We had a baby that was sick as snot. Lo and behold, we discovered its spinal fluid, etc., was septic with herpes. In most babies, we avoid this by treating the herpes while the mom is pregnant. In this case, the mom didn't even know she was a carrier. So where did it come from? This is the awkward and sickening moment when everyone in the room realized where the herpes came from. Turns out the father had an affair and contracted it from his lover. So yeah, while this woman's baby is on the verge of passing, she finds out her husband has been cheating on her, and his cheating bum is the reason their baby is sick. Story 12. My best friend was dating a girl and knocked her up. They got engaged and planned to get married right after the baby was born. There were about 10 of us in the waiting room, waiting for her to crank out the baby. It was essentially her parents. His were in another state, some of her friends and some of ours. After sitting there for about 2 hours, he walked out with a smirk on his face and says, "Let's go." We all thought something horrible had happened. Her friends asked how the baby is, and he said, "Fine, but black." He motions for us to go, so we followed him. In the parking garage, he tells us to follow him to his apartment, then sends me a text asking I could put him up for a while. We literally moved him out of his apartment and into my spare bedroom in like an hour tops. Her parents didn't know who to be mad at. The confusion on their faces when he told them the baby was black was priceless. Story 13. I worked with this guy a few years back. He and his wife were pregnant. They were super excited and shared the news with everyone and put stuff all over social media. So fast forward a few months and the kid is unfortunately gone. They had a professional photographer come to the hospital and they did a series of photos, holding the baby, dressing it up, kissing it on the head, the usual newborn photos. The bizarre thing is they put them all on Facebook. I found it kind of morbid, but whatever, I've never lost a kid, so that's cool. One day at work, a guy from a different branch comes into the store and congratulates my coworker, slaps him on the back and says all this stereotypical new dad small talk BS. My coworker informs him the baby was gone. The other guy refuses to believe it and keeps saying, "Screw you, man, quit messing with me. I saw the pictures on Facebook." They go back and forth and the guy finally realizes he's not being messed with. This was the most uncomfortable exchange I've ever seen between two humans. I also don't know how to feel about this. Story 14. I'm a nurse working in labor and delivery. Most of the time, if the mom thinks the baby may not be her boyfriend or husband, they will just have their friend or sister or mom with them there for the delivery and have the dad come to the hospital or room after seeing the baby. No guarantees because babies can change a lot over a couple weeks. Many African American babies have very light skin when they're born and it gets darker. Had a patient's husband get upset about the baby being too light. They were both black, until his mom smacked him and told him that's what he looked like when he was born. Recently, I had something I thought was interesting happen. Girl comes into labor with her boyfriend, sister, and a friend. Boyfriend doesn't seem too engaged during the process, but that's not uncommon. Baby is born and is fine. Sister sends dad to get some stuff. Note here, all people involved are Hispanic and only speak Spanish. My specific medical Spanish is pretty decent and I can get you through an epidural or delivery. Most things that come up pretty well, but I'm not fluent. So as soon as the dad leaves the sister, it's like, "I have a question for you," and then proceeds to say something I can't understand at all. I tried to clarify, but I'm just not getting it. I offer to go get the translator. She's like, "No, I don't want it to be official." She whips out her phone and through Google Translate asks, "How can we get a paternity test in the hospital?" I then have to explain that we really don't do that, but you can get one at CVS. They tell me that the baby doesn't look like the other child of this mom, and this guy and that it might be someone else's, but they want to check before telling him. So I just apologize and tell them how they can get a DNA test at CVS, and they're like $50. This isn't the first time I've been asked about paternity testing. I just had no idea how you say it in Spanish. Story 15. Not a doctor, but a distant cousin of mine definitely has children that don't belong to the father. My cousin was adopted as an infant. She struggled with some developmental issues and has a low IQ compared to most, but can still live on her own with little to no issues. She, a white woman, married a Latino guy, really dark brown skin several years ago, and they had a son together who has dark hair, dark skin, and dark eyes. He's easily identified as their son. The real trouble happens years later. Her husband, who we'll call Javier, has some IQ issues of his own. Just a little slow when it comes to tasks and reasoning. Anyway, Javier is in the military and gets deployed internationally for about 6 months. When he comes home, his wife is 4 months pregnant. You do the math. He still believes the baby is his own, even after it's born with pale skin and blonde hair and blue eyes. If that wasn't bad enough, it happens again, 2 years later with another baby. Same blonde hair and blue eyes. Everyone knows she slept with a different man. It was actually her high school boyfriend, but Javier still thinks the children are his. Yeah, it's kind of sad, but at this point, there's not much you can do. He's raised the kids as his own. W dad, L mom, for sure. Story 16. If you guys are enjoying this thread, you should watch Lauren Lake's paternity court on TV. My favorite case was the one where the female spent almost the entire 25 minutes going over all this proof that the kid was his, using facial similarities, swearing up and down, and even bringing in witness to test that she was of good character and wouldn't cheat. Even straight insulting the guy, saying how crappy it is, he denies his child and won't grow up, etc. Through all of this, the guy just stood there quietly, not saying a word, not defending himself, nothing. Finally, the judge asks if he has anything to say or would like to plead his case. He motions to the only thing on the desk, a manila folder. Plaintiff takes it to the judge. She opens it, reads for a minute, then dismisses the case in the favor of the guy. Turns out he had been deployed overseas in Afghanistan during the year before and during the entire pregnancy and birth. He came home after 4 years and was introduced to his 2-year-old child. Story 17. Neither a doctor nor nurse, but a good friend of mine was out of the country in an emergency with his work, and I ended up bringing his wife to the ER. My friend and I are, even still, best friends, and all of us went to high school together, and I have no idea his wife was unfaithful. However, I was in the delivery room as she didn't want to be without anyone there. Baby came out. Straight up Asian. I knew. The OB knew. I just walked out of the room then. All I could hear, her wailing, saying her marriage is over, and the nurses quickly picked up on why she was crying. They called him and told him the news. He explained to his work that a true emergency was at home, so they chartered him a flight home. Saudi Aramco high-class action. And he filed divorce right then and there. During the divorce, out of their 3 kids, 0 were my friends. It didn't just mess my friend up, it messed the kid up as well because they knew him as daddy. The court tried to make my friend pay support for those kids who weren't his because they became accustomed to it, and the dad abandonment was borderline criminal. He had 0 biological attachment. Family courts are so biased against men. My friend spent a fortune fighting it out of principle and eventually won. It emotionally ruined him, and now he doesn't trust women. He won't go on dates or anything because of it. I can't say I blame him, but that is beyond messed up. Story 18. My coworker's aunt just found out her dad wasn't actually her dad. So she was really big into genealogy and had mapped out her family tree as far as she could go. She took one of those ancestry DNA tests about 2 months ago, and her father's side didn't line up with what she was expecting. In fact, she didn't recognize a single name that she was matched with paternally. She casually asked her dad if he knew any of the names, and he recognized the surname of the maintenance man at the apartment complex where he and his wife, aunt's mom, lived shortly after they had gone married. Claimed he was a lousy repairman who always flirted with his wife, etc. Aunt's mom had passed away a few years ago, so she decided to not tell her dad the news. If you're enjoying the video, don't forget to hit that subscribe and like button for more videos like this. Story 19. Not obligatory, not a nurse or doctor. My brother told me the story about a man he used to work with. Brother's work friend is from an Eastern European country and came to the US many moons ago and started his family here. One of his sons meets a nice girl. They plan to get married, but life happens and then more life ends up coming out of them. Whole big family is excited about the new baby. The father-to-be is absolutely ecstatic. They have a small ceremony before the baby is born, yada yada. Delivery time comes, and out pops this little boy who is about 50 shades darker than either parent, and the new dad absolutely loses his crap. In his heartbroken rage, he accuses his new bride of cheating on him, disowns said child, and rages right out of the delivery room, leaving the new mom all alone with her mound of shame. This guy returns to his family and continues his hate-filled rampage and exclaims to his family that his of a wife had cheated on him because the baby looked nothing like him in skin tone. The family's shocked. Never would have believed this sweet young thing would do that to their son. Absolute shame and misery all around. Well, sitting in the dark little corner of the room, little tiny grandma chirps up and has a story to tell. Apparently, back in her glory days, during some war or another, she had a great summer with a French soldier. A black French soldier. She got knocked up and he got sent home, and back then you kept a baby and hoped your family didn't end you before you could abandon it somewhere. She ended up meeting her husband shortly after getting knocked up, and things just progressed as if it were his child, and wouldn't you know, the little thing popped out white as snow and she breathed a sigh of relief because this was going to be the easiest lie to keep, ever. So this poor schmuck has been carrying around the super melanin gene his whole life and knocked up his wife, and it decided to all come out on his sweet little boy, who he now has to go crawling back and reclaim. Thankfully, the whole family went with him to the hospital. Old grandma had a picture of her old fella as proof, and husband and wife were reunited. Wow. That is the biggest... sorry about that. What I was just saying is that was the biggest plot twist out of all these stories. Story 20. I was sample typing a newborn once. Mom was an O positive, baby was AB positive, which is more or less not possible. I immediately panicked because, Jesus God, they mixed up the babies. Someone has the wrong baby. We're gonna get sued. They're gonna have to genetic test the entire nursery. What if they subpoena me for being the idiot who discovered the problem? I don't have insurance. What if they sue me? After repeating the test 3 times, I called the floor and told them that they'd either drawn the wrong baby samples or they'd switch babies because mom couldn't be the baby's mother. Well, no, it was a donor egg. 3 draw matched fine. Everyone was where they were supposed to be. Oh God, my heart though. Story 21. Not a doctor or nurse, but my dad was accused of being the father to a child that wasn't his. So basically, my dad was accused by a woman he slept with. My dad wasn't exactly the most faithful man, that the child was his, even though the child was mixed. The woman was white, and so was my dad. The case actually went to the Trisha show, like the Jeremy Kyle show, but older. The test results came out, and shockingly enough, he wasn't the father. One moment from the show, Trish asked my dad, "Do you have any other kids?" And he just smirked. I never really found out how many women he got pregnant at the time, and it's likely I went to school with my brothers and sisters, but neither of us knew we had the same dad. I never really found out what happened to the woman or to the baby either, but I truly do hope that the baby grew up healthy and happy. And I hope the mother found peace with herself. Story 22. Not a medical professional, but I know of a related court case that made it to the state's highest court. Black guy and white woman are married. She's a former street worker, and at some point they separate. He moves out of state, she moves out of state, and she goes back to working. Guy gets a phone call around 9 months later from a friend or relative of his ex saying that his ex is pregnant and ready to give birth any day now. Guy drives across the country so he could be there for the delivery. Baby comes out and is white. Has blue eyes and red hair. Mom says it must be a Trix baby. Seeing as the guy's black, he understandably pieces out. Later on, the mom's parental rights are terminated. As you can imagine from the work, she was not a fit mother. And the state went about trying to find the dad to be notified or before the kid can be adopted. Since the dude was still her husband at the time the child was born, legally he was the presumptive father. The state does genetic testing, and twist, turns out he is the father. For an extra kick in the pants, the state ends up terminating his parental rights for abandonment. Not a happy ending. Story 23. I worked labor and delivery. Had a very young mother come in, accompanied by parents. She was just 12 to 13, and parents looked stuffy and kept telling her should have had a termination. She was too young, etc. Her mother was silent the whole time, but leaked tears for her constantly. While she labored, I received a call from a very young boy who said he was her boyfriend. His trembling voice explained that her father wouldn't come to the hospital. I explained that I couldn't give out information, but he could talk to her afterward. I went in, told her he had called, and she showed me a picture of him. He had white, straight, red hair, pimply and tiny. The runt to the litter. About an hour later, her physical education teacher stopped by to check on her, which I thought was odd. We didn't get many teachers checking on students. He was opposite of the boyfriend as he could get. Tall, very muscular, beautiful smile, and rich, chocolate brown skin. The girl's father accompanied her to the delivery room. Odd, but okay. The more she pushed, the louder she cried. In between, she kept saying, "Sorry, Daddy." Finally, out slid a very beautiful chocolate brown baby boy. I thought her father was going to pass the crap out on my delivery room floor. I did my usual, "It's a boy," and said nothing else. I handed him off to a nursery nurse and got Dad a chair. The new mom said, "I'm sorry, Daddy," over and over again. Her mom, now frowned up, came to see the baby, took one look, started asking God for forgiveness, and left. I sent her dad home a short bit later, admonishing him to react at home, not here. I set up a time for a counselor to meet with him before I left. After talking to the new mom, she admitted her gym teacher had been giving her special treatment. I explained intimacy to her, and she said she'd only kissed the BFF, but had stayed after school to be with her gym teacher. I'm state mandated to report child mistreatment, so I did. 2 weeks later, with her world shattered, her baby was given up for adoption. I wish her the best. Of note, this was 1989. Story 24. Obligatory not me, but my great-grandmother. Great Granny grew up and lived in a very bad or poor area of a city near a military base around World War I and World War II. In order to make ends meet, she became a street worker. Our understanding is that she was very good at her job and therefore very popular with all the military men around. She did not care what you looked like or your skin color as long as you paid. Her first husband finally figured out that she was the infamous town worker when her first kid came out very obviously mixed. They got divorced and she found a second husband that didn't mind it at first. One white child and 2 mixed babies later, they divorced. Repeat with 2 out of 11 known living kids being 100% white and a total of 5 husbands, as well as several boyfriends and fiancés walking out on her. Stories are that the hospital staff used to make bets on how soon she'd be back and what mix. Black, Native American, Asian, Hispanic, etc. the kid would be at that time. Story 25. This is off topic, but it reminded me of something. Some of you might know who Steve Nash is. For those of you who don't, he was a former NBA superstar basketball player. Well, during his prime, his wife got pregnant, and the media liked to ask Steve questions about it sometimes, so it was known his wife was pregnant. Well, literally the day after his wife gave birth to their son, Steve filed for a divorce. It was largely swept under the rug, and nobody ever talked about it again. Come to find out, one of his black teammates was sleeping with his wife, and it was his kid. That player ended up getting traded to a different team about a month later because I'm assuming Steve didn't want him to be on the team. This is still widely unknown to the public because everyone involved did a really good job of hiding it. Story 26. I was hoping someone in this thread would have a similar story, or be able to answer this, but I haven't come across it. Long story short, I do marketing for a housing company, and this entails getting testimonials from residents at our properties. This one couple I talked to were probably in their 40s and told us that their kids were finally out of the house, so they decided to downsize. After the formal part of the interview was over, the couple was still talking to us and said something like, "Yeah, we couldn't wait to get on with this part of life, but then we accidentally had a third kid. Despite what they say, those dang vasectomies don't work, because I still knocked her up." The wife's eyes were wide and she was looking at us with a panicked expression on her face. I know my own expression had changed from a smile to pure confusion, but I honestly couldn't help it. Still not sure if they were telling us the truth or if that the guy had actually been raising someone else's kid for 18 years. Story 27. I was doing epidurals in residency. This Caucasian couple was from a more rural part of the country and they don't look or sound particularly educated. Anyhow, wife is particularly antsy, asking when she can go home, even though the baby isn't out yet. Husband looks bored and uninterested, like he's been there a whole bunch of times. I usually don't stay in the rooms during delivery, but this one I just happened to be nearby to give more in the epidural because of a tear immediately after delivery. Anyhow, when I get to the room, the wife is holding her eyes shut and doesn't want to see the baby. I look at the baby and is obviously black. Now the husband is paying attention and he sees what I do. He keeps repeating, "When that baby gonna pink up?" Louder and louder. The OB tries to diffuse things by reminding everyone that this moment is critical and suggests the baby should be taken to the resuscitation area in the NICU and that the father should step out. He called the social worker and security and I was called elsewhere, so I don't know what happened afterwards, so I can't imagine it was good. Story 28. No, I'm not in the medical field, just married into an odd family. About 15 years ago, my significant other's youngest brother got really sick. Was in and out of hospitals and seeing a bunch of doctors. I was admitted yet again, and my father-in-law called and asked all the siblings to come, just in case. We were the last to arrive. We got there, and everyone was completely silent, obviously having been crying. Both thought, "Oh crap, he passed away." My significant other started to tear up, and his dad came striding towards us, tears still running down his face, and said, "Well, let's step outside. There's something I have to tell you." Turns out father-in-law wasn't really the youngest brother's dad, nor was he the dad to 3 other of my significant other's siblings. The hospital wanted to run some tests on father-in-law and stepmother-in-law to rule out something. I don't remember what, and they had to come clean. The siblings were 25, 26, 27, and 28, so kind of messed them up for a bit. Story 29. My horrible ex-coworker had this happen to her. She was a horrible person for many, many reasons, but one of them was that she cheated on her husband with his best friend. Coworker and her husband both had extremely blonde hair and light blue eyes. The best friend had thick black hair, dark brown eyes. Everyone knew it was a possibility and realized as soon as the baby was born. Apparently, it was a very awkward day. The coworker and husband are still together 16 to 17 years later, although their relationship is pretty much loveless. They had another baby, it was his. Coworker does not allow the biological dad to see the kid, which I think is a crap move. Husband obviously treats the kid that is his better than the one that isn't. A coworker complained about this constantly when I worked with her, but did nothing about it. It's a really, really crappy situation. The baby is now a teenager and absolutely despises her stepdad and now has some behavioral problems. Story 30. Not the exact story you're looking for, but I'm a med-surg nurse. I had an older male patient who was in for anemia with critically low hemoglobin levels, receiving a few units of samples. I've been taking care of him in the last couple of days, and his daughter was visiting at the time with the patient's wife and him. We had to do our 2-nurse identification process for the samples, where we go over the name, ID numbers, and sample type for confirmation before hanging it on the patient. When we were going through it, the daughter stopped us and asked us what type we just said. I didn't really understand why at the time, but I told her again, and she got really concerned we may be hanging the wrong samples. She said that couldn't be right because she was an anatomy professor and there was no way the cross-match could be right. Because she was AB and she knew her mom had type A, so her dad couldn't possibly be A either. I didn't think much of it, and we went back to the doctor to ask him for another cross-match, and he was like, oh yeah, she might not be his daughter then. We ordered another cross-match, and sure enough, it came back as an A type. She just sat in the corner really quiet the rest of the day with a really sad look on her face. Her mom and dad didn't really get what was going on, but I know she had some idea. Story 31. Kinda happened to my mom. My biological father is Greek with very pale skin, and my mom is a white Western European mutt. When I was born, I had very dark skin and a full head of thick black hair. They didn't seem concerned, but his mother freaked out, called my mother and grandmother not so nice names, and left. My father ended up splitting us when I was about 3 weeks old with no explanation. A couple months later, my skin lightened. All of my black hair fell, and it turns out he was the father. We've never tried to reach back out to his family because in that first year of my life, they went through a lot of drama, including arrests, rehab stays, drive-by, an affair followed by divorce, another baby mama my mother didn't know about. The list goes on. My father and I tried to form a relationship when I was in high school. It went okay at first, and then he got weird very quickly. He insisted to call him dad, insisted on regular visitation, routinely showed up at my friends' and boyfriends' houses causing a scene, insisted to get family pictures with his new lady and his 5 other kids. None of us have the same mother, and this is not including the baby he had and ditched before he got together with my mom. I regret ever trying at all. He and his family were and are still trashy hot messes, and I'm glad my family decided to keep me away from them. Cherry on top, he was working for my now husband's parents when my husband and I first met. Once his parents found out who he was and what had happened, they fired him so I would never have to run into him at their business. He had it coming anyway, so they were glad to finally stop making excuses for him and let him go. Story 32. This happened to my brother. He broke up with his super crazy girlfriend, and a couple months later, she started calling him, telling him she was pregnant. He was very skeptical that the baby was his. We all were, because after they broke up, she basically slept with everyone who would. So we waited for months so she could have the baby and my brother could get the paternity test. He was in the delivery room, and I was waiting right outside to support him. So after the baby gets cleaned up from delivery, he comes walking out with this weird look in his face and shows me the baby who looks more like his clone than his son. My brother passed away when his son was 10, and every time I see my nephew, it's a little shocking, because I swear I'm looking at my bro. It makes me miss him a little less, though, and my nephew is more like a son to me. Turns out you are the father. Story 33. My cousin was an obstetrics nurse in a Central European country. 2 women were in the maternity ward. Sadly, one lady had delivered a still baby and was terribly upset. She told my cousin she and her husband had been trying for a baby for many years without success. She had difficulty conceiving and they had a couple of miscarriages. She and her husband were overjoyed to carry a baby to term. The husband was not present in the ward that day, but the lady said he would be devastated to find out there was no baby. The other lady delivered a healthy baby, but was also upset. They were poor and already had 4 children at home. Their finances were stretched. She did not want to look after yet another baby. Her husband was very upset she was pregnant again. Not that he was blameless, but that's a different story. He was at work and was not at the hospital that day. My cousin talked to the other nurses. No paperwork had been completed. So the staff put both women in the same room with the one healthy baby and suggested they may want to talk. 40 minutes later, the lady without a child was holding the healthy baby. Both women looked happy and relieved. Few words were spoken, but the paperwork was written up by the staff to reverse the records of the 2 births. The lady who suffered a stillbirth went home with the baby she wanted, and the other lady returned, relieved, to her home and the 4 other kids. They were of the same ethnic background and had similar features, so the swap probably went undetected. I don't know about the ethics and legality of all that, but it was human. I will say that. Story 34. Last time this question was asked, I related the story of a guy, white, who was in the same delivery room as me and whose girlfriend, also white, gave birth to a boy who was black. She started to stutter something about being sorry and it was only a one-night thing, only for him to say, What? It's a boy. Now we can get a Scalix trick set. Yeah, I thought this was so obviously a joke that I didn't bother clarifying it was made up. It's actually ripped off a spoof ad I saw years ago. But people took it literally and thought it was real. Made me feel bad, and I've never told a fake story on Reddit again. Not even for a treat fitty. Story 35. I might be the first medical professional to post on this thread. God damn. So I'm an NICU nurse that was floating to the nursery. A baby was born with a genetic abnormality but was otherwise doing fine. Pediatrician was in the parents' room discussing with him the follow-up type stuff for the baby, appointments with a geneticist, an orthopedic surgeon, etc. At some point in the conversation, the mother asked what the baby's type was, to which the pediatrician responded, A positive. The father of the baby insisted that was impossible, as he and his wife, this was their third baby, were both O negative. The pediatrician got totally flustered and came back to the nursery to verify the lab results. Baby really was A positive. We even went so far as to redraw the baby samples and retest it. Nope, A positive. There is absolutely no chance that the baby belonged to that man. The husband left the hospital soon after and didn't show up again until it was time to pick up the mom and baby to bring them home. The mom spent the rest of the hospital stay lying alone, in the dark, mostly hiding under the covers. Story 36. Healthcare worker here. A lady came in to deliver that mild schizophrenia, but stopped her meds for the pregnancy and was doing well with therapy. Had the possibility of 3 different men being the father of her son. One who accompanied her but had no interaction with the baby and wanted a paternity test. The mother did really well with bonding and caring for the baby, but when she went home, she ended up mentally declining and off to a mental hospital. 2 days after he left, the baby was admitted for dehydration and weight loss. After he was all better, the man who was present for his delivery didn't want to take him, as he had little knowledge of newborn care. The little baby was put into foster care. A week later, the newborn was in intensive care with permanent brain damage related to being dropped by the foster parents. My heart ached so bad for this family and the situation. So not exactly an it's not my baby situation, but it's pretty close. Well, if you like these stories, here's more. YouTube thinks you're going to love this. Catch you in that video.